bersatu dalam Sarawak yang tercinta. Rakyat hidup aman dan bahagia. Satu impian sehati sejiwa, jasamu disanjung dalam Malaysia.
Terbang tinggi burung kenyalang, anugerah bangsa penuh gemilang.
Untukmu kami rela berkorban, demi cinta aman dan kemakmuran. Untukmu kami taat, setia berbakti untuk Ibu Pertiwi. Kami sayang kita, oh Sarawak. Kami sayang kita, oh Sarawak. Berjuang ke arah perpaduan, bersepakat menuju kemajuan.
Satu impian sehati sejiwa, jasamu disanjung dalam Malaysia.
Terbang tinggi burung kenyang, anugerah bangsa penuh gemilang. Untukmu kami rela berkorban, demi cinta aman dan kemakmuran. Untukmu kami taat, setia berbakti untuk Ibu Pertiwi. Kami sayang kita, oh Sarawak. Kami sayang kita, oh Sarawak. Sarawak madah tubuhnya, Ibu Pertiwiku yang kita punya. Harumkan nama di mata dunia, barulah Malaysia madah tubuhnya. Kami sayang Sarawak, kami berjuang. Musuh datang melawan, kami si cuak. Bersatu hati, sehati sejiwa. Kami sayang kita demi Sarawak. Hati hidup akhirnya laban, Sarawak tercinta dipertahankan. Hati hidup akhirnya laban, satu matlamat, satu impian. Untukmu kami rela berkorban, demi cinta aman dan kemakmuran. Untukmu kami taat, setia berbakti untuk Ibu Pertiwi. Kami sayang kita, oh Sarawak. 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 Kami sayang kita, oh Sarawak.
Putri Sentubung, putri sejinjang, penjaga gunung negeri Sarawak. Manis kasih ada dapat dilawan, anak dan dewa turun kayangan. Putri Sentubung, putri sejinjang, penjaga gunung negeri Sarawak. Manis kasih ada dapat dilawan, anak dan dewa turun kayangan.
Sang tubuh puteri menenun
Suatu harinya dua kelahi, beranok-ranok si henti-henti. Seorang madah diri bagus agi, seorang si kalah walau sampai mati. Putri Santubong, putri sejinjang, penjaga gunung negeri Sarawak. Manisnya si ada dapat dilawan, anak dan dewa turun kayanya. Putri Santubong, putri sejinjang, penjaga gunung negeri Sarawak. Manisnya si ada dapat dilawan, anak dan dewa turun kayanya. Putri Santubong, putri sejinjang, penjaga gunung negeri Sarawak. Manisnya si ada dapat dilawan, anak dan dewa turun kayanya. Putri Santubong, putri sejinjang, penjaga gunung negeri Sarawak. Manisnya si ada dapat dilawan, anak dan dewa turun kayanya.
Santubong puteri menenun kain malam. Sejinjang puteri menumbuk padi siang.
Suatu harinya dua kelahi, beranok-ranok si henti-henti. Seorang madah diri bagus agi, seorang si kalah walau sampai mati. Putri Santubong, putri sejinjang, penjaga gunung negeri Sarawak. Manisnya si ada dapat dilawan, anak dan dewa turun kayanya. Putri Santubong, putri sejinjang, penjaga gunung negeri Sarawak. Manisnya si ada dapat dilawan, anak dan dewa turun kayanya.
Sarawakku sayangku, kebanggaanku selalu, aman makmur selamanya Sarawakku. Rakyat bersatu padu, pemimpin mengambil tahu, menuju mercu Sarawak maju. Kita anak Sarawak, sama-sama jaga Sarawak. Kita sayang Sarawak, sanggup berkorban untuk Sarawak. Oh ha, bening raungkan bersama. Membara di dalam jiwa. Inilah negeriku, tanah tumpah darahku. Sama-sama kita jaga Sarawak. Sarawakku sayangku, kebanggaanku selalu, aman makmur selamanya Sarawakku. Rakyat bersatu padu, pemimpin mengambil tahu, menuju mercu Sarawak maju. Kita anak Sarawak, pertahankan Sarawak. Oh ha, oh ha, mari laungkan bersama. Oh ha, oh ha, membara di dalam jiwa. Inilah oh negeriku, tanah tumpah darahku, sama-sama kita jaga Sarawak, sama-sama kita jaga Sarawak.
Welcome and salam sejahtera to the second day of the 10th UNIMAS Public Health Seminar 2024. We will begin our program shortly, but before we do, there is few housekeeping announcements from the organizers. You will be automatically muted upon signing into the link. You are requested not to share the link to any other persons without obtaining prior permission from the organizers. Kindly register your attendance as per the QR code. CPD points for all participants will be automatically updated. As for CPD points for speakers and e-poster participants, you will need to submit the claim and relevant documents to claim on the CPD platform. E-certificates for participants, speaker, and e-poster participants will be emailed to you within a week's time. Any question that you would like to raise to the speaker during the presentation, please drop them in the Q&A box. Last but not least, if you face any difficulties, do not hesitate to contact our team in the chat box. Thank you.
bersatu dalam Sarawak yang tercinta. Rakyat hidup aman dan bahagia.
Satu impian sehati sejiwa, jasamu disanjung dalam Malaysia.
Terbang tinggi burung kenyalang, anugerah bangsa penuh gemilang.
Untukmu kami rela berkorban, demi cinta aman dan kemakmuran. Untukmu kami.
Good morning and salam sejahtera, ladies and gentlemen. Welcome back to the second day of the 10th UNIMAS Public Health Seminar 2024. It is a privilege to have you all back with us today. My name is Dr. Joseph Unja, and I will be your MC for this morning. For your information, today we will have 3 plenary sessions. As a kind reminder, again, if you have any question for the speaker, please make sure to type your question in the Q&A box. Those questions will be brought up during the Q&A session at the end of presentation. Without further ado, let us begin our 10th Public Health Seminar with our first plenary session for today, Building Resilient Healthcare and Management of Disaster. Before that, allow me to introduce our first moderator for this session, Professor Dr. Anselm Suting. He is both a public health physician and occupational physician in the UNIMAS. Currently, he is lecturer at the Department of Community Medicine of Public Health and coordinator for Doctor in Public Health Program, DRPH, in UNIMAS. With that, we invite Professor Dr. Anselm Suting to moderate our first plenary session for this morning. Over to you, Prof.
Okay, good morning, everyone. Right, welcome to the third plenary session of the 10th UNIMAS Public Health Seminar with the theme Building Resilient Healthcare and Management of Disasters. My name is Dr. Anselm, and I will be the moderator of this plenary session. So today we are very fortunate to have an esteemed speaker from National Disaster Management Agency, Lieutenant Colonel Dr. Ajanta Sugamurthy. Now, Dr. Ajanta is the Deputy Director of the Operation Coordination Section of the National Disaster Management Agency in the Prime Minister Department. She's a medical doctor by profession with more than 15 years of experience working in the Ministry of Health Malaysia. And after serving in the National Health Financing in Planning Division of Ministry of Health, she pursued her Master in Business Admin. She has been a part of the Malaysian health system research, working closely with Harvard University from year 2016 to 2018. Now, she has contributed to several important publications, such as Malaysian Health System Research Volume 1 and Malaysia Health Accounts 97 to 2018, and Supply and Needs-Based Requirement Projection of Malaysian Human Resource for Health using System Dynamic Approach 2016 to 2020, and Human Resource for Health Country Profile 2015-2018 of Malaysia. So Dr. Ajanta, along with her team, have coordinated several disaster management workshops in many states in Malaysia, and was also a part of coordinating team for Turkey mission. She was also a speaker for COVID-19 related topics on multiple platforms organized by Ministry of Health and other non-governmental organizations during our recent COVID-19 pandemic. And with her vast experience in health system and disaster management, I think Dr. Ajanta is the most suitable expert to talk to us on the national disaster management in Malaysia. So with this, let us invite Dr. Ajanta to give her talk. So Dr. Ajanta, are you here?
Hi, Prof. Yes, can you hear me?
Yeah, Dr. Ajanta, can you test your mic?
I'm actually speaking. Can you hear me?
Yes, we can hear you now. Okay, so the floor
Okay.
is all yours, Dr. Ajanta. Thank you.
Okay, thank you very much. Thank you for the introduction. And I must thank UNIMAS before I start my talk, because I think these kind of platforms is actually very, very important, especially to have a lot of doctors. I'm very excited to see a lot of doctors who's come and join talks pertaining disaster and also the climate change. And, it's very difficult to get this many people in one platform. So kudos to the team, and it's very well organized as well. So as Prof mentioned earlier, I'm a medical doctor who's in the national disaster team now. So feel free to ask me, because everybody is learning everything new every day, right? So I will understand your language. We can speak a common language for the medical people here. You can ask me any questions. There is no right or wrong. There is no silly questions, okay? Because trust me, before I entered NATMA, I had a lot of questions myself, and I was so overwhelmed with my medical things, and I didn't really get to know what NATMA is. So now that I know, I'm happy to share. Okay, slide. Okay, so I'm here to mainly talk about the disaster management in Malaysia. I'm sure you had other speakers to speak on other areas yesterday, and one of my colleague, who's the commander of SMART Search and Rescue Team of Malaysia, who also shared his experience about his mission in Batang Kali landslide. So today my focus here is to explain to you the entire disaster management in Malaysia. So when a disaster actually happens, we know who to go to, where to go, the terms they use, so we are not just like lost during that time. So coming to the definition is very important, what we call a disaster and what not. So I was telling my liaison officer, Dr. Ayu, today, talking in the platform with full of doctors itself is a disaster, yeah? Just joking. So now what is the definition of disaster? The important things here is basically a serious disruption of the functioning of a community, okay, or national affairs involving widespread of human. These are the important terms to call a thing a disaster or not, okay. Widespread human, material, economy, or environmental losses, and its impact which exceeds the ability of the affected community or society to cope using its own resources. That means they can't handle, they have to go to a higher level for aids and things. That's depending on the level, which I'll come later. But disaster is this, the serious disruption involving human, material, and economy, which they can't handle on their own. Next, please. Okay, in the disasters that happen in Malaysia. So you see, my topic is resilient in healthcare, means like the mitigation and things like that. How are we going to bounce back when something actually happens, right? Likewise, even in disaster management, earlier, we did not have any proper disaster management. I will tell you how. You see, in 1968, there is a sorry, I'm going to present in a dual language here. I'm going to speak Bahasa and English, so it's easier to communicate. So if you can see, this is a 4-story building which collapsed. Okay, so this is the time everybody, before that, nothing really happened. So when this thing happened, everybody was lost. Who is going to rescue them? Is it Bomba? Is it PDRM? Who's going to do it? So that's when the politicians at the time probably they had a penubuhan Suruhanjaya, siasatan diraja. Siasatlah dulu, siapa macam mana nak buat kan, baru nak siasat. Alright. So that's when also they had a semakan semula kod bangunan. Okay, so they want to standardize the kod bangunan. Next, please. Later on, In 1991, we all know we had this big fire outbreak in a firework factory. Yes, Kilang Merchun in Sungai Buloh, Bright Sparkles. Yeah. So this is the time when something already happened. Only then we said, okay, that's it. We have to ban this firecrackers in Malaysia, and that is also when they came up with the hazmat team in Bomba. Next. 1993, we all know this a big incident happened in Highland Towers where they had a collapsed condominium, yeah, in Hulu Kelang. And this is something huge and something that we were not prepared for. And this is when the Jemaah Menteri actually decided, you know what, we need to have a disaster management, and this will be placed under MKN. MKN is the National Security Council. Yeah, and that time the disaster management was placed under MKN. And also later on, they came up with MKN 20, which is Directive number 20 in 1997. And in 1995, Smart Team was built. Smart Team is the one I told you just now, Malaysian Search and Rescue Team, who the commander gave a talk yesterday, right? Next, please. Now, in 2008, we had this Bukit Antara Bangsa incident where there is a landslide which involved about 14 bungalows, and 4 people died and 15 was injured. And again, once something happened, and then we said, we have to have a penyeragaman garis panduan, building the houses on the high-rise place, tanah tinggi. From 2009, we had that in place. Next, please. And final bang was 2014, where we had a massive flood. We do have flood every year. We anticipate it. We knew that's going to happen. But the worst one at that time was 2014 in Kelantan, Terengganu, Pahang, and Perak, where if you can see the number of victims there is 500 or 1,000, and the loss to the country in total is 2.9 billion, and how many families are affected, how many PPS was built at the time, and look at the number of deaths. Okay, so this was the big impact where the country decided, just having a disaster management is not going to help. We need a separate agency that's going to focus on flood only. Flood only, yeah? At that time in 2014, NATMA was built. This decision to have a different agency to look for flood only. Then was NATMA formed in 2015. Okay, next, please. Okay, after that, as you all know, 2020, COVID-19 was there. I'll speak on this a bit later. And this again, we were not prepared, a lot of things we learned after COVID-19. This is the pandemic. Next, please. And the reason one we had was the landslide, Batangkali landslide. I wouldn't say that we were not prepared. This is a disaster that happened, and it was handled very well by our team, together with all the other agencies. Next, please. These are the other diseases that has happened in Malaysia. Just sharing with you for your knowledge, the cholera outbreak, H1N1, SARS, and finally the COVID-19. Next, please. Now, so this is NATMA. When we say NATMA, what is NATMA? NATMA is the National Disaster Management Agency in Malaysia, which was established in year 2015. We're under the purview of the Prime Minister's Department. And the purpose of this is National Focal Point Agency for Disaster-Related Matters. This disaster-related matters is something that happened along the time. It's no more just flood, yeah? We're not just taking care of flood. Like, I remember when I joined NATMA, somebody, my KKM colleague, they asked me, hey, what's NATMA? The same thing that comes out for all the flood, right? I mean, I won't blame them. I would have thought the same thing before going into NATMA. Okay, so it's not just the flood. And we have our DG, and we follow everything that's under the directive number 20. Now here, you may ask, what is the difference between NATMA and MKN? I know this is a golden question. Many people would not understand properly. What is the difference between NADMA and MKN? Because MKN also is involved in quite a number of disasters. What is the difference? So if at all you ever come across this question, the answer is MKN, okay, National Security Council. They follow directive number 18, and NADMA, we follow directive number 20. MKN deals with crisis, NADMA deals with disaster. I hope this is clear. When it comes to like security elements, like hostages or terrorism and things like that, automatically it will be handled by MKN. Yeah. Okay. Next, please. Okay, so basically this is what the directive number 20 is all about. In short, it's just a framework, like a national guidelines on disaster management and the mechanisms on disaster management. It provides the level, clear guidance on the level of disaster management. There are 3 levels, which I will speak to you later. And the organization structure and the responsibilities of agencies that are involved. Now, this is very important because when something happen, everybody should be clear of their roles, not that, I don't think this is my area. No, I think you should come in first. No, you should do this. This kind of confusion is something we really don't want during a disaster. When everything in place, when there is a proper interagency coordination and everyone understands their role very well, things can be handled very easily. For example, the Patangkali incident. Everyone was clear, everyone knows their role, and everything went on smoothly. So where does this MOH responsibilities come in disaster? Well, is there any disaster that we don't need MOH? I don't think so. MOH is like automatically by default, you are in charge in every, you have to be involved in every disaster, right? So the things, I don't think my slide here justifies the amount of things MOH can do, but a lot more than that. But the simple things I can mention is the emergency treatment for the victims and the first responders, and the ambulance services, the forensic services, medication, health services, disease control, and provide mental health services. This mental health service is also very, very important in a disaster for the victims and the victims' family and things like that. Yeah. Next, please. Okay, so everyone may ask, so if you are in charge, like I said, a colleague who asked me, so Nadma is in charge of flood, right? That only comes end of the year. So another question everybody may have is, if Nadma is only going to take care of flood at the end of the year during MTL, what do Nadma do the rest of the time, the rest of the year? What is your role actually? It's not like we don't have work at all and we're just active during disaster. When there is no disaster, what do we do? So I will explain. Nadma is basically a coordinating agency. If you ask me if there is a disaster, can Nadma handle a disaster alone on its own? The answer is no, a big fat no, because definitely we have to have all the other agencies who are working together, and we will be the mediating or coordinating agency among all the other agencies. That means we are the coordinating people to make sure everybody is on the same page and to make sure everyone knows their roles. Okay, and this doesn't just happen during a disaster. Okay, what's the roles and responsibility of NADMA? As I said, is a lead agency for disaster management, drafting disaster management policy. I'm sure we have to have a national policy, right? So the drafting part is done by NADMA, and regulating and implementing the policy also comes from NADMA, coordinating disaster risk reduction initiative. So not only we wait for the disaster to happen, we also have the mitigation part where we can reduce the disaster risk. Yeah, I will explain a bit more later on this. And we have a lot of disaster management, charity training coordination. We have public awareness program, because I think the public are very much involved. If you can see the recent flood in Sri Muda, I'm sure everybody would have heard of it. How the awareness of the public is very important. How the really resilience of community is very important. It's a good time to learn, and we improve ourselves. I wouldn't say that everybody is perfect every time in whatever we do. So eventually, things that we overlooked or we could not coordinate, we have to learn, we have to improvise. It's not to blame each other. You've done mistake and I've done mistake. No, for the country, we have to learn, we have to evolve. That's what happened in Sri Muda flood. Yeah, public awareness is important. So that's why we need to have after action review, because if you don't have a AAR, after action review, you wouldn't know where we went wrong, where are the rooms for improvement. Next is managing Kuaban. So yes, Natma deals with a lot of finance. During COVID, for example, I can give you those who were affected by COVID or COVID death due to COVID. Everybody had their own compensation, and even the side effects of vaccine had, they could claim, but a lot of process is there. The doctor have to certify and things like that. But NADMA is the one who will be giving the funding for the vaccine also. And when there are flood victims, for the family, the funding comes from NADMA as well. They call it Duit Korban, yeah? Okay. And then there is JPBP committee, lead HADR mission. Lead HADR mission is like the international mission. Wow. NATMA is, we have smart team, which is INSARAG certified. Means it is not like any country can help any country who is in need during a disaster. You have to have certain certification for them to accept your help. And Malaysia, I'm proud to say we do have this certification called INSARAT, and we are able to help international. That is, for example, Turkey the other day, right? So mobilizing smart team also comes under NATMA, because smart is under NATMA, yeah? Right, next. Now, this is what I meant by we don't just take care of flood. These are the type of disasters NATMA is dealing with. So the natural disaster, like, flood and tsunami, the natural disaster, yeah? So industrial disaster, as you know, could be like gas leakage or big industrial disasters, hazardous material transportation accident. For example, a train who is transporting a chemical and it had a collision and, chemical spillage or gas or something like that also comes under NADMA. Structural collapse. And as I said, we have smart team who is very highly trained in high-rise building collapse. Okay, that is why the expertise were very much appreciated in Turkey. So structural collapse comes under us, air crash accident comes under us. But when I say air crash accident, doesn't mean any accident that is happening on air comes under NADMA. Okay, I will explain a bit more later. Basically, if there is any crash accident on the air and something lands on the floor, that becomes NADMA's job. Okay, we have other agencies as well working in everything. Every disaster will have the lead agency. For example, COVID, the lead agency was Ministry of Health, but the coordinating agency will be NADMA. So, train collision, fire outbreak. If let's say train collision, we go back to the term of disaster. If the train only had 2, 3 people and it had met with an accident, we don't call it a disaster. If there is a train which is carrying like about 200, 300 passengers or even few passengers with a chemical or something, yes, then NATMA comes in. Fire outbreak, a huge fire outbreak, not any fire outbreak. Yeah. And burst hydro dam, reservoir, CBRN. So we have heard of CBRNE, and there's only CBRN here. Where is the E? Why is NADMA not taking care of E? Okay, first of all, what is CBRN? Chemical, biological, radiological, nuclear. And if the E is there, that's explosives. Okay, I've already explained earlier, when there is an element of security, like explosive, or terrorism, that comes under MKN. So CBRN, we only take care of CBRN, okay? And then there's haze, and that's epidemic, pandemic, COVID-19, for example, and other diseases declared by the government, means it's not here yet. In future, if there's anything, big disasters, that's also going to come under NADMA. Next. So this is what I meant, that every disaster has its lead agency. Like, for example, when there is a maritime disaster, okay, the maritime people will be the lead agency, but we will be the agency peneraju. Okay, when there is a bencana udara, air disaster, the one who will be leading is the CAAM, and we will be the leading agency to coordinate. No, we won't be the leading agency. We will be the coordinating agency. Okay, so there is a chemical, radiological, nuclear. Bomba will take over. Bomba will take over as the first responder, the agency penyelamat and things like that. And the atom department also will be there. But again, NATMA will be the coordinating agency. And Haze. Haze, as you can see, Jabatan Alam Sekitar will be the main leading it. And for pandemic and things like that, KKM will be the lead agency. Okay, next. Okay, this is what we call interagency coordination. This interagent collaboration and coordination is actually very, very important. This is just a sample of thing I gathered that collaborated during COVID-19. If you can see, all the important agencies are there. Without this kind of good collaboration and coordination, I don't think we could have handled COVID at that time. In fact, every disaster we need collaborate with other agencies as well. Okay, slide please. Now, this is what I meant by the level of disaster. Maybe some of you already know, but it is my duty to, explain a bit more on this. So it could be just a refresher for you all. When it's a disaster management level 1, what they mean by disaster management level 1 is just that it's happening in a localized incident. It's very controllable and has no probability to spread. That is just the district level. So who can handle this disaster management level 1? Does NADMA have to involve in this? If it's the face-to-face session, I will have a lot of interactive questions, but because this is online, I'm just going to keep talking. You'll just have to listen, yeah? So level 1, basically, the district officer is in charge. Okay, the disaster management will be at the district level. Now, let's say at one point, this level 1 is spreading, is getting a little more, and the district is not coping, unable to handle, not enough assets, not enough resources, and things like that. And it goes to level 2. So level 2 is where the incident is covering 2 or more districts, but still no potential to spread. So it's level 2, and this will be taken care of at the state level. Okay, and let's say if it spreads even more, it's very complex and covering wide area or more than 2 states, then it will be level 3, because here you need greater financial support, human resource, and assets. So now this is where NADMA comes in. But it doesn't mean that NADMA is going to close an eye to disaster at level 1 and level 2. We still keep an eye. We do have a lot of trainings where we go to every state in Malaysia. We have also been to Kuching and Cebu and places like this, Basrawa. We have already gone there, and we already gathered the district officers, the doctors, the police, the PDRM, APM, and the state secretariat to guide them and to give them simulations like a real life scenario, like a tsunami. How do you react? Who comes first? How do you work with the JKM? How are you going to work with the media and things like that? We do a lot of training sessions like this, so everybody is aware of the role at level 1, level 2, and level 3. Yeah. Okay. Next, please. So this is the disaster management cycle in one picture. Basically, we do have mitigation phase. We do have preparation, which is basically mitigation. And when the disaster happen, how do we respond to it? And after the disaster, how do we recover? And the reconstructive part. This is just the whole thing. Basically, what NADMA does. We have a few phases, not just during disaster. Next, please. Okay, so the phases of disaster management. Mitigation, as what I told you all earlier, is preventing the future disasters or minimizing the effect towards the risk of life, property, social, economic activities, and natural disaster disruptions. So mitigation activities take place before and after the disaster. Before, how we can reduce; after is how we can reduce in future. Preparedness is we are ready to handle a disaster. Okay, response is responding safely during a disaster. And response what this is very important, because if you know the incident in Kim, we were a little bit blindfolded, or we were in the spirit of helping others. We are doctors and things like that. We want to help others, so much so we forgot that we ourselves need PPEs. Doesn't cause any harm, because we don't know which chemical we are dealing with and what not. So the response, are we really prepared to handle a disaster? Which area we are allowed to, which area we're not allowed to, all these things also we need to know. And then the recovery part is where you're rebuilding lah. Basically, you're rebuilding back, and financial support and things like that. Okay, next please. Yeah, I think I pretty much already explained that. Prevent, like for example, for mitigation will be uh, structural planning, avoid development in landslide and flood prone area through planning and zoning. Means we emphasize on the alarm system. If there is a alarm, flood warning or tsunami warning, there should be alarm system, the dams to for flood. Like, we know flood is going to happen, we can't stop the flood, but we can reduce the impact of the flood. So that's the mitigation part, where we build the dam, so the effect is way lesser. And then, for example, there's another challenge in this also. We may have alarm system, but are the people aware? Like for example, why I'm saying this in Sri Muda, the alarm actually went off. There was a warning that flood is going to happen. Leave this place, and people are like, nah, this is just Sri Muda. Never before. Water level will only go up to the ankle, and it will go away. Second warning system was issued, and again they were like, no, I'm just going to stay home. Nothing's going to happen. And then the real disaster happened. So people being, the awareness to follow the alarm system is also important. Okay, next. Now, this is the preparedness. Preparedness actually covers a big area, because not only the mitigation is going to help, how prepared are we is going to help with the response and in the rescue operations. Now, this involves the local government responsibilities to identify hazards and assessing their potential risk to the community. This is for the national disaster management. I'm sure this is pretty much will be useful for the MOH as well. And MOH also have their own disaster management and protocols, but this is going to be, identifying things, the mitigation part, and all that's going to be same for the health sector as well. So identifying hazards and assessing their potential risk to the community, developing and coordinating preparedness plans, everything is in place there. The plan should be there. Establishing disaster warning system to the public to be alert, and identify the vulnerable group in their community. Okay, this is important, yeah, because we have teams in NATMA to actually have a communication with the community. We go down to the ground, and we have a lot of engagement with the Ketua Kampung and the local people and things like that. And we tell the importance that you need to know which house has OKU people, which house has a pregnant mother, which house has got like a stroke patient. In terms, when the disaster actually happened, who you rescue first, and these kind of things they should they should be aware, not just during disaster, people are left out and things like that. So community level is very, very important actually, to know the vulnerable group and specify a chain of command in disaster. The chain of command is very important, to know who is the commander, who is in charge. Can I take my own decision? Can I do this? Can we enter this area? This kind of thing should be very clear. Determining the community's capability to mitigate against or prepare for, respond to, and recover from major disaster, basically the recovery part. And stocking emergency supplies and equipments. These are all under the preparedness, yeah. Okay, next. Okay, so this is CBDRM of NADMA, community-based disaster risk management. If you ask me, how is Malaysia coping up with this mitigation plan? I already gave you some example of the dam just now for flood, and for community part, we have a team where we engage. If you can see in the pictures, we engage with people, all the locals. The last picture is with all the locals, explaining to them and having a good communication with them at the district level, at the kampong level even, telling them how you need to be prepared. For example, awareness talk on like what are the bags you need to, or one emergency bag you need to prepare. When there is flood, only take the bag and leave. You know, you cannot bring the whole house. So just the bag with your medication, what are things what not to bring and things like that. So these kind of things. And also we engage, we have this thing called Rakan Natma now in Natma. Rakan Natma is uh, you're a friend to Natmala. Those who are not in Rakan Natma, you're not a friend in to Natma. Okay, I'm just kidding. So the Rakan Natma is the NGOs who work very closely with Natma during a disaster. Why we have this is during the flood in Sri Muda, everybody wanted to help. Nobody knew how to help correctly. Okay, so when I was there, I saw people giving a lot of milk powder, pampers, and things like that for the victim, which is good. Which is good. People are coming forward to help. But unfortunately, many of those things were just floating on the flood water. Because why? They do not know where is the right place to give, how to coordinate this. Okay, so it's a waste of resources, isn't it? If only we could coordinate that better, it would have reached the victims even safer. So now we learn from our mistake. As I said, we have to learn from the process, learn from the mistake, and we have to make ourselves better. So right after the Sri Muda incident, we have this group called Rakan Anma. We have a very closed WhatsApp group for all these NGOs who work very closely with us. And they also helped us during the Turkey mission, where when we needed our resources to be sent and all, they came forward, okay, doctor, we will give you know, food, we will come up with some medication, we will give you this, we will give you that, will come up with the tents, we want to sponsor this, we want to sponsor that. So it's coordinated. And now they know, NGOs, if you want to donate something during a disaster, don't just go to the incident area. You can't go to ground zero. You can't leave it there. You have to go through JKM. So this kind of awareness, this kind of understanding, it's not going to just happen overnight. It's a long process where the whole team in Natma, there's a certain team in Natma. We look at different portions. Yeah, I come from the operation coordination. Some of them are looking at the social and things like that. So community and social. So they are in charge of giving this kind of awareness to the community. Next, please. Now is the response part. Response part is basically when the thing actually happened and we are responding. Here again, local government responsibilities are there. They have to assess the damage caused by the emergency and activating response plans and rescue operation. Now, self-responsibility is another thing. If you want to help, what's some agency you think you can be helpful, find out the commander in charge in the disaster area and follow the command. Commander is there to give command. So basically, we have to follow the command. Now, there's a question here. When there is a disaster, who is the commander? Is Nadma the commander? Okay, the answer is police, yeah? In every disaster, police is the commander. Now, who is going to be the deputy commander? It's going to be from Bomba. Okay, there is a clear guideline on all this. Every disaster, police will take lead of everything. Police will be the one identifying who they will need to coordinate with. I'll talk about that a bit later. Now, because it's commander here, I'm just telling you, you have to follow the command, execute the activities according to competencies, and don't be a disaster in disaster. I love this quote because I say it in all my talk. What happened is, in Sri Muda, a lot of people came to help. They brought their boats because people are in there and they want to help, so they brought their boats and things like that. So there's already a disaster going on, and the little they know, they were, in fact, they were walking on the water trying to push the boat and all that, and there was electric cable. So we need to rescue the rescuer. So this is what I mean by don't be a disaster in a disaster. Understand the flow properly. Just because you want to help, you cannot make the rescuer's life even worse. Now, next is training and tabletop exercises. Like I said, it has been conducted in all the states. Next. Okay, this is where I told you when the disaster happened, you have to understand this term PKTK, Pos Kawalan Tempat Kejadian. That means this post will be opened at the disaster area nearest to the ground zero, where the police is the commander, and the police will identify what type of disaster is this, whose expertise do I need. Will I have to call the atom people, or do I have to call I mean, MOH by default, everywhere you are involved everywhere. So, you're going to be there. The other agencies with the relevant agencies. So the commander is the one who will decide. Now, if you ask me, can the DO, district officer, give orders to the commander? See, the commander is doing his job, so the district officer can give orders to the commander. The answer is no, yeah, but they can work closely, can talk to each other, they can discuss, but commander is the commander. The decision comes from him. Okay, so he needs to take care of the operation, the communication, the search and rescue part, and the other things like medical and where to forensic and things like that, and who he will be reporting to. Now, commander have to have another system helping him, right? Because he's on the ground. He will need help from somewhere, right? That is called PKOB, which I will come to that later. Next, please. This is the one I told you just now. On-scene commander is always the police. And we have forward field commander from the bomber. And we have on-site medical commander. We will have one medical commander to give orders to the medical team. Yeah. Next, please. Yeah, this I think I already explained to you. The PKTK also take care of the media. Don't forget that. It's okay. Next. Thanks. If you can see, this is the yellow zone. The PKTK will be nearest to the, what do you call that? Ground zero. And then the medical base will be there where it's safe. And in medical, they will have red, yellow, green zone. This is just for your information. Okay. So the red zone, who is allowed into the red zone is just the search and rescue team. Thank you. Next. Next, please. Yeah, this is PKOB. So just now, PKTK is at the site. They will have to report to PKOB. Who will be at PKOB is the district officer and all other relevant agencies. For example, in PKTK, the medical team decides that, we can't access to the place. There's a tsunami and there is a pregnant mother trapped somewhere. I need helicopter. It's very difficult for the doctor and at the site to decide this. So this message need to be passed to the PKOB. That means in PKOB there also will be a wakil from a representative from every agency having regular meetings, update from the PKTK, and see what they can help, with resources, what else they can supply to the PKTK to guide them and help them. So the reporting has to be done to PKOB. Okay, so the PKOB people will sit and discuss, okay, where we can get a helicopter from, what's the fastest way to do it. Okay, let's provide them this. So this is PKOB's job. Next, please. Now, the recovery process is again, ensuring the shelter, medical assistance, and the city basically helping the citizen to come back to normal life as soon as possible. Okay, and the financial part as well. Next, please. After action review, as I said earlier, you need to have this after action review in order we can, we can learn, we learn, unlearn, relearn all the learning so that we can perform better later. Next. Okay, now building resilient healthcare. This is very interesting, and especially to be talking in this kind of form. How resilient is our healthcare? It's a golden question. Now, during COVID-19, the health system have been ill-prepared, I would say, to tackle such unprecedented burden. No one was prepared. It came without any warning, correct? To increasing the resilience basically involves three capabilities: absorptive, adaptive, and restorative capacity. Okay, the system is able to absorb the impact of a crisis, adjust to the undesirable condition, and finally, but rapidly returning to the status quo or even better. Measures to strengthen the healthcare exist in several areas. I will mention a few important areas how we can strengthen our healthcare is by having a good information and communication system and interagency coordination. This I'm coming out of disaster management to health, yeah. So how this health system can be better, this information and coordination communication is very important. That's something that we learned during COVID-19, how the entire state has to report to CPRC were gathering the data, and DG was giving the press relief and all that. So again, the information and communication is very, very important. Strategic communication is extremely important. As you can see, during COVID-19, if DG gives a statement about the numbers and people are like, are you sure this number is correct? Are they under reducing the number? When DG is not giving the number anymore, it must be really high. That's why DG is not giving a number. So, whatever you do is wrong. So communication again is very important. Second thing is interagency coordination. Not only for NADMA, I think even for KKM, the interagency coordination is very, very important because they have to be where they cannot just strengthen the healthcare on their own. They have to work with, basically for disaster, they have to work very closely with the overall disaster management of the country. Or they also should be working closely with the ATM and the military, where they can be a very great help for asset support and things like that. And they should know when they can use those kind of resources and where to ask the resources from, right? The welfare department comes a great help, like during when we are shortage of PPE and there's a lot of people there, but hospital is struggling to provide food for them. JKM comes in handy. So have good communication with these kind of agencies. Even civil protection is important. Public private integration, all this comes under mitigation part, where we already have all this in place, not just wait for disaster and things to happen. We have all this in place, then the resilience will be much better. Correct? This is something we never really had during COVID, but of course, there is a big, huge room that we can always improve. Above all this is the leadership and what do you call that? Is basically the leadership and governance lah. Sometimes we want to do something, but the policy doesn't allow, politics doesn't allow. So we have to have that final say from somewhere. So that has to be in place before the disaster for the resilience to be good. Without that, that is going to be the whole the big challenge. Yeah. So basically, the whole government approach is needed to enhance the resilience of health. Now, the pandemic has put health system under such extreme stress, they had to adapt to changing circumstances while continue to provide high quality healthcare. Ongoing and future challenges such as antimicrobial resistance and climate change also requires resilient health system. To enable reliable and shock resistant services, healthcare must be linked to the overall country's emergency management, as I said earlier. Now, how to build a resilient healthcare? In short, basically, a wide range of enabling factors need to be strengthened, such as adequate equipments. We should already have. We cannot. Okay. Maybe if I say these kind of things, UNIMAS might not want to call me for the next talk, but I will still say it. Okay. We cannot always say, hey, MOH got no money, MOH got no money, and that shouldn't be a reason. We have to know how we're going to have this kind of equipment when the need actually rises. Okay. Adequate equipment, financing, like what I say, no money, MOH, no money shouldn't be an issue. Okay. Skilled staffs to handle disasters, efficient information system, efficient management, and operational protocols. Okay. And when the resources are limited, where you need to get the resources, and data-driven approaches for coordinated service delivery and coordinated response is very important. How, who's supposed to handle what? Okay. So the emergency preparedness of health system need to be closely coordinated with the country's overall disaster and crisis management as well. Must have a clear mandated crisis response Basically, during a disaster, everyone should be able to talk a common language, unlike COVID-19. Medical is looking at the medical part. Oh, we need this, we need this, we need to shut down, we need to have protocols, because if not, the thing is going to spread and we need lockdown. And then the economy part, people coming, oh, no, 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 if you have lockdown, we're going to lose in economy. We cannot. So these kind of things, everybody's have got their own agendas, their own importance. So during a disaster, everybody should be talk one language, so it's important and it's smoother. Next, please. So I think come to the end. This is pretty much just photos that I want to share with you. This is our smart team. Look closely, I'm right in the middle. Although I don't know why on that day my baju had to be same color with the smart team. Okay, I'm not here. I'm not the search and rescue person, but I'm very proud of the smart team in our country. And yeah, that smart team picture. Next, please. Okay, this is a picture to show that they practice almost every day. They have practice in their own base, how to help with high-rise building collapse, this kind of shooting, diving, rescue, all types of rescues. Okay, next, please. We have all our assets like boats, all this big breaking a big rock to help people to collapse things and all that. Turkey is a big thing. If you give me another day, I'll talk about the Turkey mission, the whole experience. It cannot comprise everything in 1 hour for me. So these are some pictures, and that's the flood in. There's a flood picture which we can take from our system. We have a system in NDCC where we can actually capture pictures like this. Okay, next. Okay, this is the Turkey mission. Some photos for you. When our country send rescuers to other countries, we don't just send the men and machine and say that, hello, Turkey, we have sent people, please guide them. It's not like that. When we send people from here, we have to equip them with everything. Things like even water, camp, medicine. It's going to be cold, so gloves, warm clothes, lip balm, soap, all these things have to go from our country. Okay, so this is all the tent, and you can see the food supplies and all there in the next picture in all big black boxes. Okay, next. And this is them in action. Next, please. Again, this is the K photos, just for you to see. Next. Yeah. So this is our glorious moment where a Malaysian team could rescue someone. Okay, maybe this is not the photo, but we did have, because this looks like a dead body here, but we did have glorious moment of rescuing someone alive. Yeah, I'm very proud of that. I'm very proud of this, because saving even one life matters. Next, please. This is our officers there in Turkey purchasing things for their daily use. Next is one of our colleague from Bomba admitted due to pneumonia and things like that, because the extreme weathers, really our officers also had a lot of challenges there. Next, please. Okay, this is them rescuing. Next. Okay, this is Batangkali, where they got the bodies, dead bodies. And some of them very sad actually to be there to witness it. They're just families all lying down next to each other, and this was indeed very sad. Although I was a doctor, to see such, it was very sentimental scene actually. Next. Yeah, these are the pictures of the family of the Batangkali incident. I mean, the thing is real. Imagine they just went for a vacation and this thing happened to them, right? Next, please. So this is why the mental health need to come in for the families as well. These are our heroes, Denti and another dog, to identify the dead bodies. And I must tell you, they're super good in what they do, because when they recovered a body, I was with the body looking at things like that. And later on, when I passed these dogs, they were barking at me. I think they sensed the dead body smell on me. So, I was thinking, why they're not barking at anyone but me? But so, how good they are now. Next. Okay, I think that's all from me. Basically, the success and effectiveness of disaster management effort depends on the cooperation, understanding, and ability of all agencies and departments to carry out their responsibilities as outlined in the MKN 20. Thank you from me. And if you have any questions, feel free to ask. Thank you.
Thank you. Thank you, Dr. Ajanta. Thank you for sharing your experience with us. And your presentations was very informative and very insightful. I'm sure the audience have benefited a lot from your presentation. So now we have around 10 minutes, okay? And we have few questions here they would like to pose to Dr. Ajanta. Let me see, the first question. First question is from Dr. Daniel. Dr. Ajanta, sometime during flood, we at the PKD need to come out to set up static clinic. So the question is, what is your advice? Should the KKM come first or wait for NAPMA to set up the pusat pemindahan sementara first? Because usually we're being instructed by pejabat kesihatan to go to PPS, but the PPS are not yet prepared, and that's the dilemma. So, Dr. Daniel would like to ask your opinion whether they should come first or they have to wait in that kind of situations.
Okay,
Right.
ideally, yes, if the PPS is prepared, it's much easier for the medical team to go and set up their base and treat the patients, ideally. But, you know, different states have different challenges. I don't know where is the delay, which shouldn't be. We shouldn't be, because everyone should know, everyone is well funded, because we have allocation for every state every year for this PPS setup and things like that, depending on the severity. Like, for example, if you ask me, Kelantan gets a big fund because they actually have flood. Putrajaya doesn't get as much because we don't really anticipate flood. So everybody has got a big sum of money to actually have this PPS ready, and they know during MTL it should happen. That basically there shouldn't be any delay. Okay, but if there is a delay, I think what I would say is it's not wrong for medical team to go first, set up wherever safe a proper area for them to give the initial medical treatment first and wait for the PPS to open. It's not wrong. I mean, as we all know, we are all doctors and people come first to us. System later. That's my personal opinion.
Okay. Okay. I hope it is clear, Dr. Daniel from Dr. Ajanta. Okay, then the next question is from Dr. Siti. Were there any example of resilient healthcare, and what did they do? What did they do that we could learn from? And in your opinion, have Malaysia caught up and become a resilient healthcare? And what are we doing? Are we doing right? And what can we do to do better?
Correct.
Yeah.
I understand the question, and I think this is a question to everyone, whether how good are we doing? How prepared are we for the next disaster? Because we weren't prepared for COVID-19. We were hit bad. We learned from it, but how prepared are we? I must tell you that we have the MOH have their own disaster management themselves now. Like whatever I said, NATMA is doing now. MOH have also started. You know, they have CPRCs in every state. They have a lot of engagements now with ASEAN, with WHO, and things like that. Discussing and having a lot of tabletop exercises. For example, if tsunami hits, what's going to happen? If there is a chemical leakage, what's going to happen? For example, they also had a huge program in Kuantan where there's a petroleum plant. If there is a gas leakage from there, how are they going to coordinate? And they coordinated with all the other agencies. This is just an example I'm giving you. So I would say it's better than before. Although nobody is 100% perfect, but our country is moving towards that. and more and more. Last time during COVID-19 here, if most of the people were admitted only in Sungai Buloh Hospital, because at that point Sungai Buloh Hospital is very much trained in disaster handling. I'm sure you all know Dato Alwi. He was in this disaster management and things like that. But right now, I think for many things, many doctors are there, and the government is not government, Ministry of Health is working towards this resilient healthcare. Their data keeping is much better. The communication is much better. We have learned. I would say that we have learned from COVID-19, and it's in place now.
Okay. Dr. Ajanda, probably I would like to ask one question. Can you share with us your opinion on what a disaster resilient hospital should be to better against any disaster?
In my opinion, I think you mean you only want to know about flood disaster hospital, is it?
Yeah, because we
Or
have
any
a
disaster hospital?
terminology called a disaster resilient hospital. So what do you think it should
Okay.
be
All
to
right.
fight for any
So,
form of disaster?
yeah. So basically, overall, disaster resilient hospital, they should be able to anticipate and prepare for any type of disaster. Like, for example, if you have an infectious disease, you must have place where you can quarantine people. It's not like a normal functioning hospital. I mean, you can't just have a hospital waiting for disasters to happen. It should be a normal hospital, but you should have the facilities for certain disasters. Like, if this is the quarantine area, ED was going to accept the patient, but ED cannot handle all the patients. So I'm going to send you here. I have this department to sell a proper communication within the hospital itself. That is internal. External, that hospital should be able to communicate with the higher, which is the HQ. There should be a proper communication and fast. It's not like, you take one meeting 3 months later, you decide something, and then another meeting 6 months later, you get a decision. It's not like that. The communication and the hospital should be very well prepared and engaged ahead with all the other agencies like Bomba, police, and all. They should work very closely. That means I can just take a phone call and, I need this, that kind of things. So preparedness, it's all about preparedness. You have to have the kind of resilient hospital in disaster in order for us to bounce back fast and bounce back better. Not like COVID, we took such a time, right? So in my opinion, I think that's what the communication, the infrastructure, the accessibility, and things like that. They should think it as an overall thing. How, when actually something happened, how to handle. Yeah.
Okay. We have one more question from the audience, Dr. Asfina. She asked that, okay, currently most of the young generation are always rebellious at doing dangerous stunts to get social contact, especially during disaster. So do you think we should have a policy to prevent this behavior so that they don't become disaster in a disaster?
I mean, yeah. I mean, that's a good suggestion. Policy, yeah. I don't know whether this is doable, because even adults, when you tell them not to do something, and they, like, for example, I told you about the siren, isn't it? There is a siren, there is a flood coming, please leave, and they don't want to leave. And what more, this younger generation? I wouldn't say a policy, but yeah, some we can enforce the PDRM or this kind of thing. They can enforce, like, if you have this kind of videos uploaded, we can take actions on you and things like that. The PDRM level, maybe not the NATMA level, but the other security level people should think it's good. Less TikToks anyway. So yeah, I think I'll encourage that.
Okay. Yeah. We are a bit short of time, so I think I'll just take the last question. So what is your advice to our future public health medicine specialists among the audience to ensure that they are prepared for the next pandemic?
Yeah, I think heads off to the public health, because your guys are very very much involved, and I think all the programs that you're having, in terms of like zoonosis and diseases and all that, prevention and things like that are all in place. But I urge for the public health specialists also to have a very vast knowledge about disaster. For example, the simple things of who you should deal with, what are the assets available that you can seek help for, because we can't just work like I'm just going to focus on the Ministry of Health. I don't care about what JKM can provide me. For example, resources like mental health. If you ask me, whenever we have these programs in states and all that, I'll ask them, how many mental health doctors do you have that can give mental health service? They tell me one. So is one mental health person enough to take care of the entire disaster in one state? No. But do you know that JKM also have mental health services and things like that? So use them. These kind of things, I think the public health doctors, I urge and I kindly request that to be more vigilant of disaster management overall as well, so that when disaster actually happen, we don't just focus on the medical part. We have to know the entire process to make things um, faster and better coordinated.
Yeah. Okay. Yeah. I agree with you, Dr. Ajanta. I think we are short of time already. It's 9:57. Okay. So yeah, we have listened to Dr. Ajanta on her experience, in the NAPMA, as well as opinions, available opinion to all our current and future public health medicine specialists. So I think we stop the session now, and we all thanks Dr. Ajanta for her presentation this morning. Okay, Dr. Ajanta, thank you.
Thank you very much. Thank you for having me. See you all next time.
Okay, thank you.
Thank you very much, Professor Dr. Anselm Suting and respected speaker, for such a wonderful sharing. Ladies and gentlemen, we will now take a short break. At 10:30 a.m., we will resume with viewing of the e-poster presentation. Thereafter, we will continue our seminar at 11 a.m. with the next plenary session. See you after the break. Thank you.
perkhidmatan bas hidrogen percuma di Kuching yang dijanjikan Kerajaan Sarawak akan mula beroperasi esok.
Hydrogen bus service will officially commence in Kuching tomorrow.
Bahan api hidrogen utama di
Servis bas hidrogen percuma di Kuching ke di Semaya Perintah Sarawak sudah berengkau beroperasi hari itu.
The downtown heritage loop about 14 kilometers and Damai loop of approximately 67 kilometers. At the moment, bus is free for the tourists and those who are residing around that area.
Hello, apa kabar? Nama berita semua. Sekarang ini saya berada di hadapan Hotel Riverside Kuching di mana lokasi pertama ataupun lokasi permulaan bagi bas hidrogen laluan lingkaran damai. Umum mengetahui bahawa bas hidrogen merupakan sistem pengangkutan awam baru di negeri Sarawak dan julung kalinya diadakan di Bandaraya Kuching. Menariknya, negeri Sarawak merupakan negeri pertama di Malaysia yang melaksanakan sistem pengangkutan seumpama ini dan ianya percuma untuk warga tempatan dan pelancong yang menaiki sistem bas ini. 3 buah bas hidrogen yang disediakan di Bandaraya Kuching melalui 2 laluan iaitu lingkaran warisan pusat bandar dan lingkaran damai yang akan mula beroperasi pada pukul 7 pagi hingga 7 malam setiap hari. Jom ikuti saya untuk merasai sendiri bagaimana pengalaman menaiki bas hidrogen yang canggih ini. Laluan lingkaran warisan pusat bandar, bas akan bertolak dari tebingan Kuching menuju hentian seterusnya iaitu Sentra Timur, Jalan Ben Ho, Hotel Riverside Majestic, Kubahria, kawasan Kampung Melayu hingga Kampung Bandar Shah 2 sebelum kembali ke tebingan Kuching melibatkan jarak 14 km. Manakala bagi laluan lingkaran damai dengan kira-kira 67 km, bas hidrogen ini akan memulakan perjalanan dari Hotel Riverside Majestic menuju hentian seterusnya iaitu Museum Sarawak, hentian bas 11, hentian bas 12, hentian bas Petrajaya 1, hentian bas Petrajaya 2, Damai Central, hentian bas lain yang ditetapkan sebelum kembali ke Hotel Riverside Majestic.
Baguslah, senang untuk rakyat tu lah. Mudahan macam orang nak pergi kampung Haji Bahabul ke, senang sikit. Sebab dia ada bas bah. Macam nak pergi Kubahria ke, senang lagi bah. Macam nak pergi Kubahria tu susah bah. Mau tu lagi, ya terus stay ke Kubahria bah.
I think that it's a good idea. It keeps the atmosphere clean. It makes it healthier for people, and it's good for the environment. Yes, there should be more buses running on hydrogen or batteries. Kuching is quite clean atmospherically compared to, say, Jakarta or Bangkok, where there's so much pollution from the heavy vehicles. So hydrogen electricity is going to be able to keep the environment clean for a lot longer, less polluted, better for the people.
Sambutan daripada penumpang dari tempatan ataupun dari luar adalah baik, dan kami orang dapat feedback yang baik daripada penumpang daripada sama ada penumpang tempatan ataupun daripada luar. Dan weekend adalah masa yang paling peak lah bagi kami orang, sebab weekend memang kami orang naik sampai bila datang penuh. Pendapat kami itu adalah benda yang positif, benda yang baik sebab kita di Sarawak kekurangan pengangkutan awam. So bila kerajaan beri inisiatif tu memang bagus untuk golongan yang berpendapatan rendah dan setidaknya boleh guna perkhidmatan tu secara percuma. Dan ia adalah benda yang bagus untuk kita di Sarawak. Kami harap benda tu akan diperluaskan lagi di seluruh Sarawak.
Selain itu juga bas hidrogen ini mempunyai kemudahan Wi-Fi berkelajuan tinggi dan e-portal yang mengandungi platform e-shopping dan juga hiburan dalam bas. Selain itu juga aplikasi H2 Sarawak boleh memudahkan pengguna untuk mengesan laluan 3 buah bas hidrogen menggunakan telefon pintar mereka. Perkhidmatan bas hidrogen percuma di Bandaraya Kuching ini merupakan inisiatif usaha-sama Kementerian Pengangkutan dan Perbadanan Pembangunan Ekonomi Sarawak SEDC untuk memperkenalkan sistem pengangkutan awam yang lebih selamat, mampu milik, mesra ekonomi dan boleh diharapkan di Sarawak. Aplikasi bas hidrogen itu juga yang pertama disepadukan dengan Google Transit untuk membolehkan pengguna mengetahui jadual perjalanan, tertiban dan hentian penyambung. Bas hidrogen ini juga menggunakan aplikasi Commercial iBeacon dan integrasi untuk seluruh bandar yang menyediakan pemberitahuan tawaran dari tempat dan perniagaan menarik. Turut disediakan kepada penumpang ialah majalah dan video H2 Sarawak, H-Buses yang menawarkan pengiklanan dalam bas menerusi laman sesawang beli belah H2, apps dan skrin LCD. Akhir sekali, H2 Sarawak e-commerce store pula membolehkan pembelian atau penempahan tiket dalam talian untuk tujuan hiburan, hotel dan produk-produk tempatan Sarawak. Perkhidmatan bas hidrogen ini merupakan salah satu inisiatif Kerajaan Negeri Sarawak untuk menambah baik sistem pengangkutan awam terutamanya di bandaraya utama di seluruh negeri Sarawak. Sekiranya perkhidmatan bas seumpama ini diterima baik, ianya akan diperluaskan ke bandaraya lain, contohnya di Sibu, Bintulu dan Miri. Jadi kepada anda yang di luar sana ingin merasa sendiri pengalaman untuk menaiki bas hidrogen ini, ianya sentiasa dibuka setiap hari sehingga jam 5 petang. Saya Sudawi untuk tvsarawak.com.
Most people think of climate change as just an environmental issue, but the World Health Organization has declared it the biggest threat to health in the 21st century. Climate change is an urgent problem that affects our health in many ways, now and in the future. Already, we've seen a rise in extreme events like heat waves, floods and bushfires. These events affect our health, threaten our food and drinking water supplies, and pollute the air we breathe. All of these issues affect our physical and mental health. But it's not all doom and gloom. There are simple things we can all do to protect ourselves and our loved ones from the impacts of climate change. And the best part is, they help us to stay healthy and save money at the same time. For example, things like walking or cycling instead of driving, eating a diet full of fruit, veggies and whole grains, reducing the amount of processed and packaged foods you eat, and choosing tap water over bottled water and sugary drinks not only help to reduce your impact on the environment, but also improve your mental and physical well-being. It's also important to look out for those who are most at risk to the immediate impacts of climate change, like the elderly, children, pregnant women, and people with chronic diseases. To adapt to our changing climate and make sure we're reducing the risks of further problems, we all need to work together, from government to industry to communities, right down to individuals. We all play a part. Climate change and health. Act today for a healthier tomorrow.
Stay away from rabies.
With Bobby and Oyen.
Hi, friends. I'm Bobby the dog.
And I'm Oyen the cat. And today we're going on an adventure to learn about something super important.
Rabies. So what is rabies, Oyen?
Rabies is a serious illness that animals can get, and it can be really dangerous. It's caused by a tiny thing called a virus. But don't worry, we can learn how to stay safe.
Rabies spreads through the saliva of an infected animal. If you get licked, bitten, or scratched by an animal with rabies, you might get sick too.
Not all animals have rabies, but some do. Usually it's animals like monkeys, bats, foxes, and even dogs and cats like me and Bobby.
Here's how you can stay safe.
Don't play with animals you don't know, even if they appear cute and friendly. If you see a sick or strange-acting animal, tell a grown-up right away.
Your pet dogs and cats can be your best friends, but sometimes, when we are angry or scared, we might bite.
When we are angry, we will show our teeth. Keep away from us when we are angry.
When we are scared, our tails will be between our legs and we will try to run away. Keep away from us when we are scared.
Don't disturb us when we are eating, when we are with our babies, when we are fighting, or when we are asleep or ill. Make sure your pets like dogs and cats get their rabies shots. It's like a superhero shield against rabies. If you ever get licked, bitten, or scratched by an animal, even if it's just a little scratch, tell a grown-up immediately.
They can help you clean the wound and take you to the doctor.
Thanks for joining us on this adventure, friends.
Now that we know how to be rabies ready, we can stay safe and protect ourselves. See you next time.
You are my, that one, is it?
Yes, your moderator, Prof.
Yeah. Can I try to share my slides?
Okay, can testing.
See whether it works or not.
Okay.
File.
Okay, Prof, we can see your slides clearly.
Yeah, but like this one here. I was looking at the usual. I was
Yeah, we
looking
can
at the usual PowerPoint control, so it's up here.
Yes.
Okay, so how I unshare first, is it?
Yeah, you need to unshare first.
Then I have to go back and do all that step again.
Yes.
Okay. Okay. How do I unshare?
You click the share button next to the video.
Yeah, I clicked already.
Okay. Okay, I try first.
I think you people have to do for me.
Okay, I try first. Oh, you have to click the share button and then there's on top of it um there's a small thing that you're sharing your screen up there. It has pause sharing and stop sharing.
Pause. Share. How come I don't have that thing, huh?
It's orange in color on the top of your screen on top there.
Orange in color. On top of my what screen?
Your screen, it says you're sharing your screen and then there's a pause, there's a mute, and then there's a stop sharing. Control, Shift, and Z.
How come I don't have such thing, huh?
Okay.
Prof.
Yeah.
Just now we already saw your screen, your notes Word document there.
Yeah, how do I
Then we want to
unshare?
have- you already unshare already.
Is it?
Now we cannot see it. Just now we saw your desktop with your Words document.
Oh, but now it is still on my personal computer.
Now only see your page only lah.
Oh, okay. Thank you.
Okay.
bangsa penuh gemilang.
Untukmu kami rela berkorban demi cinta aman dan kemakmuran. Untukmu kami taat setia berbakti untuk Ibu Pertiwi. Kami sayang kita, oh Sarawak. Kami sayang kita, oh Sarawak.
Sarawak pada tubuhnya, Ibu Pertiwiku yang kita punya. Harumkan nama di mata dunia, barulah Malaysia pada tubuhnya. Kami sayang Sarawak, kami berjuang. Musuh datang melawan, kami si cua. Bersatu hati, sehati sejiwa. Kami sayang kita demi Sarawak.
Hidup lagi ngelaban, Sarawak tercinta pertahankan. Hidup lagi ngelaban, satu matlamat, satu impian. Untukmu kami rela berkorban demi cinta aman dan kemakmuran. Untukmu kami taat setia berbakti untuk Ibu Pertiwi. Kami sayang kita, oh Sarawak. 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 Putri Sentubung, putri sejinjang, penjaga gunung negeri Sarawak. Manis kasih ada dapat dilawan, anak dan dewa turun kayangan. Putri Sentubung, putri sejinjang, penjaga gunung negeri Sarawak. Manis kasih ada dapat dilawan, anak dan dewa turun kayangan.
Sang tubuh puteri menenun kain malam. Sejinjang puteri menumbuk padi siang.
Suatu harinya dua kelahi beranok-ganok si henti-henti. Seorang madah diri bagus agi, seorang si kalah walau sampai mati. Putri Sentubung, putri sejinjang, penjaga gunung negeri Sarawak. Manisnya si ada dapat dilawan, anak dan dewa turun kayangan. Putri Sentubung, putri sejinjang, penjaga gunung negeri Sarawak. Manisnya si ada dapat dilawan, anak dan dewa turun kayangan. dua kelahi beranok-ranok si henti-henti. Seorang madah diri bagus agi, seorang sukalah walau sampai mati. Putri Santubong, putri sejinjang, penjaga gunung negeri Sarawak. Manisnya si ada dapat dilawan, anak dak dewa turun dayana. Putri Santubong, putri sejinjang, penjaga gunung negeri Sarawak. Manisnya si ada dapat dilawan, anak dak dewa turun dayana.
Ladies and gentlemen, we thank you for your present and continuous engagement in the 10th UNIMAS Public Health Seminar 2024. We are now moving on to our next plenary topic, environmental justice and health equity, disproportionate effects of climate change on marginalized communities. As a kind reminder again, if you have any questions for the speakers, please make sure to type your question in the Q&A chat box. Those questions will be brought up during the Q&A session at the end of presentation. Our moderator for this session is Associate Professor Dr. Deborah Piek Ngadan, our esteemed family health lecturer at the Faculty of Medicine and Health Sciences, UNIMAS. Let's now welcome Associate Professor Dr. Deborah to lead the session. The floor is yours, Doctor.
Okay, thank you very much, Dr. Joseph, and good morning to everyone who is present. It is my pleasure to introduce our next speaker, which is Professor Dr. Andrew Q. He is currently a professor of public health in the community medicine and public health department, Faculty of Medicine and Health Sciences in UNIMAS here. As a background of his education, he obtained his medical degree from University Malaya way back in 1976, and then he obtained his Masters of Public Health from University of Malaya in 1981, and he obtained his Doctor of Public Health in Epidemiology from Tulane University in Orleans, in USA in 1990. And he is a fellow of the American College of Epidemiology and also a member of the Academy of Medicine Malaysia. He has over 40 years experience in public health, initially as a district medical officer of health, and then as an epidemiologist, and then deputy director for public health in Sarawak, and finally as the Sarawak State Health Director. So Professor Dr. Andrew is well known internationally for his work in healthy cities and settings, and has served as a World Health Organization short-term consultants on the subject. He is also an honorary consultant epidemiologist and a consultant also for advisor for healthy cities for Sarawak state government. And his research and publications has covered numerous healthy settings, social determinants of health, micronutrient deficiencies, especially iodine deficiency, rural water supply and sanitation, as well as nutritional status of children in Sarawak. And his teaching subjects such as healthcare delivery system and global health, environmental health, as well as in undergraduates also for introduction to clinical clerkship. And if you see his citation, he has been cited almost 537 times by 521 documents and has an H index of 9. And also, other than that, his topics also include things such as internet use, addiction, young adult multi-drug resistant TB, stigma, disclosure, autism, and autistic disorders in toddlers as well. So without further ado, I would like to invite Professor Dr. Andrew to give his plenary talk. Thank you.
Yeah, thank you, Deborah, for that kind introduction. It was a bit long for the purpose, but it's okay. Now I need to share my slides back, huh? I need to, hey, what happened? It was working well just now.
Maybe you can click the presentation button.
Said too many overlapping videos. No, I want to go to, okay.
Yeah, that's one. Okay, we can see it clearly, Dato.
Yeah, okay. Okay, so thank you. I was asked to discuss this topic, which is environmental justice and health equity as the big statement, and then as an example of that, disproportionate effects of climate change on marginalized communities. So the outline of my talk is shown here in the diagram form. So first, I'll be covering climate change. I know it has been covered yesterday, but this is from another slightly different point of view. I'll be talking a bit about planetary boundaries, how climate change have made the world, the Earth, a more dangerous place to live in a way. And then I'll look at the climate change impact pathways, because this is related to how it affects the vulnerable and marginalized groups. And then we will look at climate change impact. What are the scales of climate change impact? How do we look at them in terms of spatial, that means in terms of space, countries, continents, and so on. Temporal in terms of time, and also in terms of socioeconomic and political, which is very much related to the effects on marginalized people and also vulnerable people. And of course, people are vulnerable and marginalized, but they are modified by the exposure, their vulnerability status, the fragility of where they live, and also how resilient they are. And then we will look at the climate justice, environmental justice, social justice, and health equity, because all these things happen because of these big issues here: climate justice, environmental justice, social justice, and so on. And of course, as public health people, we want to see that there is health equity for all the populations of the world. And then towards the end, we will look at climate change impact a little bit in Malaysia. So let's look at climate change. And of course, like I mentioned, speakers yesterday have talked about this, but I just want to highlight that the WHO have stated in the COP24 that climate change now is the greatest challenge of the 21st century. Of course, this was before COVID time, so after COVID time, probably it might be the second greatest challenge, or I think it is the greatest challenge even with COVID, because COVID is like a one-off, whereas climate change will continue no matter what man does and so on. The effects will be in the hundreds of years ahead of us. Okay, and of course, climate change encompasses changes in temperature, which can be either increase or decrease in terms of precipitation, which is rain and so on, severe weather events, and other features of the climate system. A lot of speakers yesterday have covered this, and we will not go into detail. But but what we will look at are the disease burden, and that we need to do something now for mitigation in order to reduce the health risk in distant populations. And no matter what we do, there will be still a net effect, because we can never adapt fully to it. We can never avert it completely by mitigation and so on. So depending on how successful we are with mitigation, with adaptation, this net health impact will increase or decrease depending on how much we can reduce these two impacts through mitigation and adaptation. So the thing to remember is that because the greenhouse gases have very long lifespans, even if we do something now, climate change will continue for at least several decades, even if radical international preemptive actions were taken very soon, which is the mitigation part of it. So that's something that we have to remember. So it is a journey for us all, and especially for the young generations who may be listening to this. I'm old now, but this will be your life in the future, your working life. You'll have to address a lot of these issues later on. And globally, in terms of occurrence, climate-related disasters dominate. So you can see here, this is global from 1998 to 2017. These are the climate change disasters, whereas the geophysical one, like earthquakes and other things, are not so much. And a lot of the climate change disasters are flooding, storms, and so on. And earthquake, which is part of the geophysical one, is not so much, etc., etc. And of course, globally, it leads to a lot of losses, economic losses, and deaths, and number of people affected, and so on. So that is why it is very important for us. And we are all part of this global change. And no matter where we work, these things will affect us to a significant degree. Okay. So I would like now, that's a brief outline of climate change. I mean, I know yesterday people have talked about whether it's anthropogenic or natural and so on, but let's look at how climate change have affected the state of the globe, of the earth. In 2009, when the committees look at this, they assess something called earth boundaries. And these are things that are global in nature, planetary in nature. They assess 7 of them. You can see the green ones here. And at that time, 3 of them were already crossed the planetary boundaries. That means that this have affected whether the planet can support us or not in terms of life and so on. And then in 2015, they still have 7. And by now, another 4 have been breached. Okay, 1, 2, 3, 4. 4 have been crossed. And then last year, they looked at 9 planetary boundaries. This happens because it's not easy to do research on all these boundaries and so on. And that's why as technology change and data management, etc., change, they can do it. So in 2023, for the first time, they have looked at novel entities which has been crossed. These novel entities are things like plastics in the environment, microplastics, you have read about that, and so on. And this has been This has been breached, and this is part of the anthropogenic change that is affecting the planet. Okay. So now we look at climate change impact pathways, and this is a conceptual framework. The Ireland Department of Health have reviewed many conceptual frameworks. They listed a number of them, but I'm going to show just a few of them here. One of them is by McMichael. He passed away already, Australian guy. You can see that for climate change, these are the definitions inside here, and it can be either due to anthropogenic greenhouse gases or natural factors such as volcanoes and so on. And this is the only one that we can mitigate, the anthropogenic one, whereas the natural one, we cannot do anything about them. And they have effects on the environment, extreme weather and so on. And these have direct effects on human health. And these are the ones where we can do adaptation. So it affects the environment, it affects the ecosystem, land and sea level will rise, and so on, and also environmental degradation, and all these will lead to loss of livelihood and other things, and it will indirectly affect human health. And of course, the direct effects will be due to storm, droughts, and so on. There are indirect impacts due to the other things that we look at just now, the geophysical and also the socioeconomic. But there are mediating factors, because where people live, their social resilience and so on will mediate the effects of all these on human health impacts. Yesterday, one of the speakers have shown another diagram showing what are the impacts from ranging from mental illness to heat stroke and so on. And yesterday, during the free paper presentation, there was a child who died from heat stroke and so on. It was presented. Okay? So we look at climate change impacts. Of course, the impact is not just on humans. It affects everything, the environmental health, animal health, and so on. But here we will be covering just the human health, because that's what this seminar is all about, the effect on human health. So in the short to medium term, the health impacts of climate change will be determined by how vulnerable the population are, how resilient they are, and the extent and pace of adaptation. So you think about this, and you can see straight away that the marginalized and the vulnerable people will be more vulnerable, they will be less resilient, they will be better adapted compared to those who are richer countries, ranging from countries to regions, to individual communities, and so on. Okay, but in the long term, it will be determined by whether humanity as a whole can mitigate the impact by reducing emissions, etc., etc. And as I mentioned just now, it is not so much the climate itself that affect human health. Of course, there are some, like extreme weather conditions and events, but more often in future, it will be the impacts of climate change on the environment and on the ecological and social factors that will have the impact on health. And this will be mostly indirect. Okay. Most of the anticipated health consequences are adverse, but some would be beneficial, at least in the earlier stages of climate change. For instance, milder winters, warming or drying in already hot regions would be reduced, but there will be mosquitoes and other vectors of disease will move up to higher altitudes. People in the mountainous regions will have now be exposed to vector-borne diseases, and people in the northern latitudes also will be exposed, whereas now they may not be. Okay, so this is in the short term. Some may be beneficial, but in the long term, most of them will be adverse consequences. And if we look at the population health impact of climate change, the easiest one to define and to study are those due to heat waves, due to floods, storm, fires, and infectious diseases, and so on. This will be easier to quantify when we want to do research on it and to quantify the effects. But the others are more difficult to study. For instance, the impact from food yields, from fisheries. And yesterday there was a free paper presentation on water quality in fish ponds, aquaculture in Sarawak, and so on. The loss of livelihoods, population displacement because of sea level rise, water shortages, and so on. This will be very difficult for us to do. And Professor McMichael, when he wrote this paper, he said that now epidemiologists, people like us, have to change the way we look at disease population health, because what we are studying now are mainly the direct factors on maybe the non-communicable diseases and so on. So now we have to look more at population health and study all these difficult things, because these will be the ones that will be affecting human health in a bigger way in the future. Okay, so the direct impacts we just quickly run through again: heat and cold, floods and storms. So you can see the related effects here, and also ultraviolet radiation, increase in melanoma, damage to eyes, cataracts, and other things. The ecosystem-mediated impacts will be the vector-borne diseases, food and waterborne infections, air quality, and all of them will lead to increase not just the incidence, but also the spatial distribution. As I mentioned, not just in terms of altitude, higher up in the mountains, and also in the northern latitudes, okay? And the social and political mediated effects will be nutrition, occupational health, mental health, violence and conflicts, and so on. Because once people, the population cannot adjust, there is a tipping point where the societies will collapse, and people will be fighting among each other and so on. So those are the things to remember. The other thing to remember is that these things about cascading effects of climate change, because sometimes there are floods and so on, and then before people can recover from one flood, there will be a landslide, there may be drought, there may be forest fires, for instance. These two are related. And this is called cascading impact, because they build up on each other, and it makes it even more difficult to adapt, etc., etc. So the frequencies might increase, the scale of it might increase, the magnitude of it might increase, and so we don't think of just one, just like the tsunami is not just the earthquake that shatters the livelihoods of people, buildings, and so on, but the tsunami that happens. So that is a very good example of a cascading impact. Okay, so climate change impacts may also cascade across partial regions. That means it's spread across countries. For instance, the tsunami of from Aceh, it spreads across not just from Aceh, but right up to the Indian Ocean and so on, and almost reaching Africa and so on. Temporal, in terms of time, just like the COVID and so on, it leads to many cascading effects about supplies of medical and other things because of limitations of transport at that time and so on, and also system scales. Many things will be affected, from small communities right up to whole of governments and so on. So that's the important thing to remember about cascading impacts of climate change. And so this brings us to something which is very relevant to the marginalized communities, because there is this thing called wooden bucket theory or Kanikin law. And they said that the capacity of population or of communities to address climate change will not be the highest one, will not be the richest people and so on, but it will be the minimum, you know, the shortest plank in these things, and that's where the overall development need to be done, because we should not forget people who are marginalized, people who are vulnerable, just because they are so few in number, and because they don't have a say, maybe in parliament or to the newspapers, etc., TikToks, and so on. So this is very important to remember, because sometimes they are forgotten, and in fact, when they want to do mitigation and so on, to maybe to have, let's say, cleaner energy and so on, is this people's land that will be affected and so on. So it's for the good of the community as a whole, but there is a disproportionate burden on people who are marginalized because they are the ones who will bear the burden of what the others are trying to do in order to mitigate the climate change. Okay? And now if we look at the scales of climate change impact, we can divide them into spatial. So it can be global, it can be continental, it can be national, ecosystem specific, and then macro and micro. So macro are the countrywide. This is the easiest to remember, the economic system and so on. The micro effects are the effects on the community as a whole. Maybe they don't have water supply because of the drought, etc. They don't have the economic means to earn their living because now the forests are gone, being done with plantations and other things. In terms of time, it can be short term, medium term, or long term. And in the short term will be all these storms, the heat waves that we mentioned just now. It can lead to immediate loss of life, damage to infrastructure, and disruptions of livelihoods. And these are called shocks because they shock the whole system. And sometimes vulnerable communities and marginalized communities cannot recover from the initial shock. And then if the cascading effect comes, it will make it worse, okay? So the medium term will be due to accumulation of changes in the climate pattern. It will alter the agricultural zones. Places that were cultivable before now become arid, become desert, etc. Water availability and the health of the ecosystem as a whole, which affects the food supply, especially those who depend on the forest for their supermarket. In fact, there is a term to say that the forest is my supermarket. I can get everything there. I can get food, I can get building materials and so on for my home and so on. This is what happens to those who are staying in these kinds of places. For the long term, it will be usually irreversible. It takes a long time. It takes eons for this. For instance, the melting of the polar ice caps, the permafrost, and so on. In fact, people are saying that this is happening now. And in fact, some ancient organisms, bacteria, have been found from the melting permafrost and so on. And people are worried that this may lead to another kind of emerging infectious diseases because these bacteria, organisms, were frozen, but they're still viable. And once the permafrost melts, they will be able to grow and so on, as if they were released from their long-term prison and so on. In terms of socioeconomic, of course, we have to think of all these effects. The others, everybody will be subjected to climate change impact. I think nobody can be said to be not affected, but the vulnerable population and marginalized population will be those who are more affected than others. So now if we look at the impact, how it affects marginalized groups, the extreme weather, marginalized people often live in vulnerable areas where hurricanes, floods, heat waves hit these areas the hardest. And then in terms of economic challenges, marginalized communities rely heavily on natural resources. As I mentioned just now, there is a saying that the forest is my supermarket. I get everything from there. And when the forest disappears for various reasons, then their natural resources are gone. Their livelihoods are very, very much jeopardized because of that. And as a consequences of this, they are unemployed, there is economic instability, there is increased poverty, and so on. And once that thing happens, then climate change-induced disasters will force marginalized communities to migrate maybe to another country or to overcrowded urban areas and so on. And this will make the situation worse. It is like a vicious cycle, okay? So who are the vulnerable and the marginalized? There is a slight difference between these two. One author, Kuran et al., described vulnerable populations as those within a country that has specific characteristics that make it at a higher risk of needing humanitarian assistance than others, and also of being excluded from financial and social services and so on. So we think about people who are in the very remote villages of our country. A lot of us here, I think the participants here will be Malaysians and so on. So we think about not just the usual Penans and the Orang Asli, but even traditional villages that are on the border for us in Sarawak and so on. So, and also in the urban areas, people are vulnerable, the urban poor and so on are very vulnerable and so on. But specifically in relation to climate change, the WHO, the UNDP have said that in the Asia Pacific region, in addition to the usual people that we think about as being vulnerable, they are mountain communities because they are very vulnerable to water scarcity, to floods, landslides, rock avalanches, and so on, and also infectious diseases triggered by climate change. As I mentioned, mosquitoes will go up to higher altitudes and so on because now it is not so cold anymore. Okay, and people in the delta regions because sea level rise and so on. And if we think about countries like Bangladesh and in the Western Pacific area, we have the Oceania group of people. Whole countries might be submerged and so on because of sea level rise, etc., etc. And also salination of fresh water. The areas that can be planted with paddy before will not be able to sustain that because of salination of the soil and so on. And then coastal areas, the magnitude of large population living in coastal areas. Even in Peninsular Malaysia and in Sarawak, we have people like that. And in Kuching, I think it is estimated that I think it's 0.3 meters of water level rise estimated over once the climate change is in full swing and so on. And of course, the urban slums, because they have poor sanitation, the waste disposal systems, lack of access to improved water and so on in urban slums and so on. And this creates high risk to those people, okay? So the difference between vulnerable and marginalized groups, of course, all marginalized groups are vulnerable, and vulnerable people are at risk due to their exposure because of limited resources, access to services, decision-making power, and so on. On top of that, those who are marginalized are also socially excluded and face discrimination based on factors such as their ethnicity, their gender, sexual orientation, disability, people who are landless, migrant workers, displaced persons, minorities, and older persons. So that's a thing we have to think about. And basically, the two difference is that vulnerable groups may not necessarily face discrimination or exclusion based on their identity, but nonetheless, they are vulnerable. But the marginalized people, their vulnerabilities stem from them being discriminated upon based on their identity, as we have, as I've shown in the previous slide just now. So if we look at the marginalized and vulnerable people, of course, they are what people like to say the usual suspects: women and children, indigenous communities, elderly individuals. There are more and more of them. But I highlight this because these are the group of people that we seldom remember when we mention about vulnerable and marginalized groups, people with disabilities. And if you think about disasters and elderly individuals, this is what Dr. Ajanta was talking about. If we want to evacuate people, we have to remember them, and we need to know how many people are pregnant in a particular place, how many are elderly and cannot help themselves, how many are disabled people, and so on. So in addition to those that we know very well about, the poor and low income groups, the migrant workers, sexual and gender minorities, and ethnic minorities, and so on. So in a sense, the marginalization is about inequality, and social injustice to them, and also unequal power relationship and so on between them and the majority decision making in the country and in the state. Of course, as I mentioned, resilience will be a part of impact. How resilient are they? And if we look at in terms of exposure, vulnerabilities, fragility, and resilience, how does it mediate all these changes on the impact on the vulnerable and the marginalized. So fragility refers to how fragile the people are. And it can be defined as fragile people when there is an impact, it will be, the size of it will be very big. And resilience, we can think of it as how soon they recover and so on. And so, for example, in an earthquake, whether the infrastructure can withstand the tremors, that is fragility of the system, and how quickly the economy rebounds after disaster, there will be resilience and so on. Of course, there are detailed descriptions of all these, but it is not our purpose here to give detailed descriptions, but to give an idea of what these concepts are and so on. Susan Cutter she's quoted a lot about this in terms of a place hazard of model of vulnerability in terms of place where you stay. How does it become vulnerable? And if we look at risk and mitigation, the things and so on, the hazard potential, of course, we know that hazard is there. Hazard multiplied by exposure equals to risk and so on. And the hazard potential will be based on the context of this place, how it is elevated, how near it is to this hazard, the social fabric, the experience, the perception, the built environment, and then this will determine the biophysical vulnerability. This will determine the social vulnerability, and all this will add up to the place vulnerability in case of something happens, like climate change or whatever, the physical disasters and so on. And once this place is vulnerable, it will increase them to the risk again. So it's like a vicious cycle again. So this is something that we need to remember. And at a certain point in time, when the resilience of a community or even whole countries and the adaptation capacities are exceeded, then we reach a social tipping point, and it will become unstable, and there will be economic instability, there will be social instability, and will be political instability, and this will lead to chaos basically in the country. And these are the things that will lead to a large-scale migration of people out of regions and so on to other countries, and all the things that are connected with that, with those migrations, kind of migrations, and so on. Okay, so now this brings us to why do these things happen? It's because of these issues here: climate justice, environmental justice, social justice, and health equity. So what is climate change justice? The International Bar Association have the following definition. It says that climate change justice is to ensure that communities, individuals, and governments have substantive legal and procedural rights to the enjoyment of a safe, clean, healthy, and sustainable environment. And so this is what we have the right to. And if this happens, what can be done? The means to take or cause measures to be taken within the national legislative and judicial systems, where necessary at regional and international levels, to mitigate sources of climate change and provide for adaptation to its effect in a manner that respects human rights. So basically, it says that everyone have a right to enjoy a safe, clean, healthy, and sustainable environment. And if those are taken away from us, that means the land and so on where people live, the environment is no more suitable, then they can take measures to mitigate, to pay for the damages and so on. Okay, so it is made up of 4 principles. There is corrective justice. So if it happens, then they can demand for the injustice to be corrected. That means to be reduced and so on. Distributive justice, it means that how the burden of the climate change and its effects have to be distributed, not just the impact to be born among the poor, but to be equally distributed even for those who are very rich and so on. Procedural equity means that we have the system to do this. That means the legal system of the world will be able for us to sue, for instance, who make all these things, affect us, and I mean those in the marginalized and so on, and also intergenerational equity. And if you think about it, for the future generations and so on. Of course, these things are very recent. You can see that the reference here is 2021, and a lot of it still need to be done here, but at least people are talking about it now. And for instance, countries like Bangladesh and so on, and also in the oceanic countries, they're thinking of how to get the developed countries to pay for the adaptation and other things that they have to face because of climate change and because of the greenhouse gases that are produced most by developed countries and by those who are very, very rich. Okay, we will see that a bit later on. And so the principle of justice are statements of what persons are owed either by others or by institutions and policies and so on. So in effect, we'll be able to claim to have climate change mitigated. The richer countries, those who produce a lot of the greenhouse gases, those people who are affected should be able to claim in a court of law, for instance, that the mitigation need to be paid by these rich countries and so on. And also sharing the cost of climate change mitigation, and for investment into adaptation, into training, into changes in lifestyle to adapt, and so on, also to be compensated. And like I said, these are relatively new things. And for instance, this is in 2015 and so on. Of course, 2019, we had the pandemic, and a lot of these are stalled for a while, but I think internationally, the discussions and so on are going on for this. And also there is a principle of vulnerability reduction, which consists of two main factors: that you be reduced to exposure to the risk, and an efficiency of resources for protecting against the risk. So these are the vulnerable people. They're exposed to the risk, and then they don't have the resources to protect against the risk of climate change and so on. So they could ask for compensation in terms of vulnerability, to make them less vulnerable to the impacts of climate change, etc. Okay, and so we have come to a world where climate change breakdown will cause even greater inequality, as you see just now, because of the vulnerability of a place, and they are more vulnerable to suffer the greater impact of climate change, and that makes them more vulnerable and so on. So these two things are very related and so on. And you can see how difficult it is that is going to do this. And you can see that this article, for instance, is very recent. It's just last year and so on. And if we look at climate change justice, for instance, and if we look at the share of consumption-based CO2 emission in 2019, okay, and this is from Oxfam, and you can see that the poorest 50% are responsible for only 8% of the emissions. The middle 40 are responsible for 40%, and the richest 10% are responsible for 50% of the emission. And if you look at the super rich, the top 1%, you can see their contribution here. They are producing the emissions more than all these things. All the superstars that are flying in their jets and so on, every time they fly, how much are they contributing to the greenhouse gases into the atmosphere and so on. So this is a picture that shows about climate change. This is about injustice and so on. So how do we have climate change equity and climate change justice to address all these things, etc. And if you look at the yearly per capita consumption of the higher income groups in terms of of how much we need to reduce our carbon footprint by 2019 to compared to the 2020-30 compatible level. That means this will lead to less than 1.5 degrees centigrade rise in temperature by 2030, for instance. You can see that the bottom 5% are within the bottom 50% are within that boundary. They don't produce, the carbon footprint is lower than what is needed to achieve this 2030. And then the middle 40, they are 2 times higher. The top 10, 9 times higher. The top 1% within top 1%, and they are 27 times. And the 0.1%, you can see that they are so much, they contribute so much to all this, 70 times 7. So because of this consumption by them, this bottom 50% have to absorb the impact of the lifestyles of all these people. So this is another example of climate inequity and so on. And this graph shows that the impact is highest among the poorest, whereas the emissions and so on is highest by the richest, and the responsibility and ability to respond will be highest among the richest. So this shows that the impact is very unfair to the poorest in the community, and also not just community, but also countries, north versus south, and etc. etc. Okay, and we also have to remember about intergenerational justice, which is the unequal distribution of burdens between generations. Are we consuming too much, such that the future generations don't have the ability to maintain the lifestyles? Remember, one of the definition of sustainability is that we meet our needs without jeopardizing the needs of future generations and so on. And this inter and intra-generational justice are about fairness between populations, as I mentioned just now, between states, north and south, but also between current generation and future generation who are still to be born in this world. Okay. Next, we go to environmental justice, because they are very much related to climate justice as well. So environmental justice or eco-justice is a social movement that occurs when poor or marginalized communities are harmed by hazardous waste, resource extraction, or land use from which they do not benefit. And this has this movement have its origins in the US in the 1980s, where harmful chemicals are dumped into those areas. For instance, if you think about the Love Canal and so on in the US, and so they have even have a fund, super fund, to remove all these hazardous things and so on. And then, of course, that was influenced a lot by the civil rights movement in the US. And then once this became successful, the movement expanded to consider gender justice, international environmental justice, and also inequalities within marginalized groups. And once it spread beyond this, then it's shifted to global south. For instance, a lot of the waste of the countries, of the rich countries, are sent to poor countries for them to sort through, and also to recycle by picking them up, not recycle in a big industrial way, but to recycle, to pick up the useful items like bottles and whatever. So this is about north-south environmental justice. And so the movement have changed to a more global level. And now even there is a UN agreement that people in rich countries should not send their waste and so on across borders and so on to the poorer countries. Okay. So after that, now we look at health equity. Health equity means striving for the highest possible standards of health for all people, whether rich, middle 40, or the poorest and the marginalized, and giving special attention to the needs of those at greatest risk of poor health based on their social conditions and so on, and to ensure that everyone has a fair and just opportunity to be healthy by eliminating disparities and improving the health of all groups. This is by the US Department of Health and Human Services definition and so on. So health equity is necessary to ensure equitable access to care, to resources and services to those who are most in need, which is our marginalized groups and also our vulnerable groups, not just during times of impacts of climate change, but all the time. Okay. So now, if we look at the climate change impact in Malaysia, not much on this. There are a few slides to show, but these are composite pictures of floods, for instance, in Kuala Lumpur and etc. So the potential impacts of climate change in the Malaysian context would include the sea level rise, reduced crop yields, greater diseases among the forest species. And because of that, one of the reasons of that is biodiversity loss, but also because of deforestation and so on. Erosion of shorelines, this is very important to protect the tidal areas and also to protect against tsunami and so on. And that's why people are replanting mangroves and so on. Increased flood intensities, coral reef bleaching, increased incidence of disease, tidal inundation of coastal areas, decreased water availability, and more droughts. So that is the ironic thing about climate change as well, because in one part of the state or in a country there will be flood, and in another part there will be drought and forest fires and so on. Just think about those of us who are from Sarawak, for instance, during the rain and the flood in the past few days, Kuching area, the southwest part of Sarawak was flooding. The northeast part, Miri and so on, was having starting to have bushfires and not enough rain, and it's very hot and so on. So in order to tackle these scenarios, Malaysia adopted precautionary principles to mitigate and adapt to climate change. One of the speakers yesterday have mentioned those topics and so on. But what we need to do is to get the whole of society to jointly participate in activities for the mitigation or adaptation to climate change through education, through training, public awareness. And this is something that is still very limited, not just in Malaysia, but also in many, many parts of the world, I think. And this paper was from Haliza 2018. And from this, the Institute of Physics, they are talking about, for instance, the personal choices that we can make to contribute to climate change. So there's something we as individuals can do, from low impact to high impact. And of course, this for the developed countries where this paper come from. But you can see that cycling, having electric vehicles and so on. Of course, now there are many things about the difficulties of electric vehicles. Cycling is very difficult for us because of it's so hot. How to cycle and go to work is very difficult compared to countries like the Netherlands and so on. And for moderate impact, they said hang your clothes to dry. You don't need to use a dryer unless it's raining, of course. We take steps to recycle things, etc., etc., and wash clothes using cold water. Of course, this is for them because it's cold. They use warm water. For us, a lot of our dryers are our washing machine. We all use cold water, and there are low-grade impact things that we can do. Do those things, and they're there. Okay, and so in Malaysia, what are the things that contribute to climate change? It will be energy. Things that can be done will be waste disposal, agriculture, industrial processes, and so on. And as I mentioned earlier, it is increased surface temperature, increased mean sea level, increasing occurrence of extreme weather, variable rainfall, and the existing mitigation that Malaysia have done. Of course, this paper is in 2019. It's from Curtin University, a lecturer there. He mentioned about national policy on climate change, 2009, and various national key economic indicators and so on, using a biofuel and REDD strategy. These are the reducing emissions from deforestation and forest degradation and so on. And then for the existing adaptation, we need to identify vulnerable zones. Dr. Azanta, I talked about this just now, that not just the district office, but for us, we need to identify the vulnerable clinics, for instance, vulnerable communities that who may be subject to floods, very frequent floods, participation in regional and international adaptation processes, which you have heard about, the Turkey and other things, other places just now. Integrated flood and rainfall management, this is something which we are still struggling with. We have systems to monitor the telemetry to say when the rain is coming in the upstream of Sarawak River, for instance, but still that does not prevent the flood. Of course, it can tell us that a flood is coming and so on, but I think it will still come. It's very, very difficult for us to mitigate and adapt those things, and online weather and flood warning. And I think I've noticed that there is a lot of change in the Met Malaysian online app, for instance, and they give warning about when the rain is coming, which areas and so on, and they are more accurate now. Whereas in the past, many years back, they used to say hujan renyai-renyai di sana sini di satu dua tempat, because now it's so much better than all that. So what does this Dr. Daniel Tang recommend for Malaysia to do with climate change? Is to set up waste segregation and recycling. This is still so difficult for us to do. Revive the B10 program. This is about 10% of biodiesel fuel in our diesel, and this can be from oil palm and so on. To review the sustainability of energy mix. First, those of you from Sarawak will talk about our premier talks about hydrogen energy, etc., etc. A more effective climate watch platform. This is something that I think we don't have it so well developed yet, and so on. Okay, so that's what I have to share with you today. So I have covered climate change, the pathways, the planetary boundaries, the new things that have been reached is the new things, for instance, like plastics and so on, climate change impacts, the scales, the vulnerable people, how the various factors mitigate these, and so on. And then we are still struggling with this. It's something new that will affect all these: climate justice, environmental justice, social justice, and health equity. Okay, so I hope I have shared something useful with you all. So with this, thank you very much, and back to Dr. Deb. Okay.
Okay, thank you very much, Professor Dato. That was a very insightful and very comprehensive talk regarding the climate justice, environmental, and also social justice with health equity. Okay, Dato, we have 10 minutes for question and answer. So I think here there are 3 questions from our audiences. From Dr. Azlan, number 1. Are there any practical steps that as a public health professional can take to address climate-related health disparities in vulnerable and marginalized communities?
Yeah, I think we have to take the lead in this, because you know, among all the government agencies that are present in all these remote communities, the highest presence, I think, is the education, because the schools are everywhere, even in very remote places and so on. And the next one is health, our health facilities and so on. None of the other government agencies are present in those particular places. And for us, there are things that we can do to what we call escalate this. That means when we see things in those places, maybe as public health officers in a district and so on, we can look at all these vulnerable populations, and it's not just directly related to climate change impact, but you remember we can we can improve their vulnerability. We can improve their resilience. For instance, by taking care of children, getting them malnourished, making sure that their vaccinations are up to date,
Yeah.
we will make them less vulnerable to the long-term impact of climate change. Of course, the direct ones when they are flooding and so on, it will be they will be affected. But the consequence of that, if people have better nutritional status and so on, and I think it's a good thing for us to start mapping all this, and we need to. I think one of the things that we haven't done as a group, at least I haven't thought about it, is that we need to map the vulnerable areas of our districts and what they are vulnerable to and so on. Of course, we are also doing this because I'm also a member of the Western Pacific Region, the WHO Office Technical Advisory Group on reaching the unreached. So this is, once we reach the unreached now and we make them have access to healthcare, we know that they're vulnerable and make them less vulnerable. I think it will. That's one of the ways that we can hope to do for them to help to adapt. Okay, that's my short answer at this point in time. Okay, thank you,
Okay,
Azlan,
thank
for the
you.
question. Yeah.
Okay, there's another question from the audience. This is Dr. Abdullah Shauki. He is
Yeah.
asking, given that rich countries are the largest contributions to gas emissions, are there initiatives where these countries allocate financial resources to assist the lower income nations in addressing climate change challenges?
Yeah, this is like I said, this climate justice, environmental justice is relatively new in the literature, but countries have been talking about it. And if you read about the COP, the COP, the Conference of Parties of Climate Change, countries like Bangladesh and so on have been fighting for this for a long time. Okay, how to get fund from the rich countries to assist the poorer countries and those who are affected most, to help them mitigate and also to adapt for these things. But it is very difficult. It's very difficult discussion because you can see that the superstars and the billionaires of the world, they talk about this, but on the other hand, you can see that they are jetting all over the world with their jets and so on, and also the rich countries, because how many people in those rich countries will want to reduce their comfort, in terms of lifestyles and so on, to have less air conditioning, etc., etc. For instance, like Las Vegas, it is impossible to live in Las Vegas if the air conditioning system is not there. And how do we get countries like that to lay aside funds, set aside funds to help this? And of course, countries like the US, China is producing a lot. Even India is producing a lot of greenhouse gases, even though its people are also very vulnerable to the effects of climate change. So it is something new, still under discussion, and it is something that we follow up, okay, to see how it develops. Those are done at supranational levels, and because it's very difficult for us as individuals and so on. But if you are in a position at higher level at the Ministry of Health and you attend in future, maybe you will be attending one of these conferences and so on, then you will be able to put your viewpoints. But just remember that these conferences are usually attended by thousands of people, maybe 3,000 or even 5,000 or 7,000. So how to make your voice heard is another story. Okay.
Yeah.
Thank you.
Okay, thank you, Prof. There's another question from Dr. Asvina. I think this is the final question. Can we apply healthy city concept in rural area for this climate issue, or is it only applicable in urban regions? Since the main contributors are the rich community, is there any policy so we can control this imbalance and inequality?
Yeah, actually, healthy city is a practical application of what is called a settings approach to health development and so on. So, of course, you can apply the healthy city principles in the rural communities, and it will combine the health promotion approach as well as the salutogenic approach. And once you apply them to these rural communities, then they will be, the name will change from healthy cities to healthy settings. For instance, healthy village, healthy settlements, and so on. And we have done this successfully many years ago in Sarawak, but unfortunately, when people change and so on, the things are very difficult to sustain. But those who are interested can easily do this in rural communities. We will start with a visioning, see where you want to be, look at where you are, what are the resources that you have, and then you will develop a plan step by step to do these things. You aim for something that can be achievable, that see results first, and then later on, once the community is used to being empowered, they can have more voices and so on. In fact, there is something that can be done as a community because just to give an example, like in Sarawak, the government is thinking of putting a dam, another dam across rivers and so on, and communities get together and they protest and say, we don't want this dam. For instance, that is another way that communities are empowered and so on. Okay, so that's my short answer. Okay, thank you very much.
Okay, thank you very much, Professor Dr. Andrew Q, for the wonderful presentation. It was very insightful, and we had another glimpse into what is the climate change impacts, what is climate justice, environmental justice, social justice, and health equity. And with that, we will end our plenary for this morning session with Professor Dr. Andrew. Thank you very much, Prof. And we hope to hear some more from
Thank
you.
you, Deb.
Thank you very much. Okay,
Yeah.
so that's all. We're back to the Master of Ceremony. Thank you, Dr. Joseph.
Thank you, Dr. Deborah and respective speaker. A very good afternoon, ladies and gentlemen. Welcome back to our 10th UNIMAS Public Health Seminar 2024, themed A Collaborative Call to Action for a Climate Resilient Future. I am Dr. Lalita Murthy from University of Malaysia, Sarawak, and it's my pleasure to be your MC for this afternoon session. Moving on, we shall continue with the 5th plenary session of the day with the topic Carbon Neutral City and its impact on the environment. As a kind reminder, if you have any questions for the speakers, please be sure to type your questions into the Q&A chat box provided. Without further ado, I would like to introduce our moderator for this plenary session, Professor Dr. Chia Wai from the Department of Community Medicine and Public Health, UNIMAS. Professor Dr. Chia Wai has her Master's in Public Health and PhD in Community Nutrition from University of Science Malaysia. For the past years, she has been actively involved in the research works specialized in community setting. Currently, she is the lecturer and program coordinator for medical research program in the Department of Community Medicine and Public Health, UNIMAS. Ladies and gentlemen, let's welcome Professor Dr. Chia Wai. The floor is yours.
Good afternoon, everyone. Thank you for joining us today in the 10th UNIMAS Public Health Seminar. I'm Dr. Chia, and I'm delighted to be your moderator for this session. While you're enjoying our lunch break, I'm sure you'll find inspiration in enlightening talk that we are going to about to listen to our esteemed speaker, Professor Shanti Farita Saleh. Professor Shanti actually is the director of the Institute of Sustainable and Renewable Energy and hold a degrees in chemical engineering. She also has some a background in process engineering and expertise in circular economy and sustainability strategies. She's very impressive. Her background, she has what we call it certificate engineering, MIE, Chartered Energy Engineering from the UK Engineering Council. She also served as an assessor and interviewer for Chartered Engineer for the Energy Institute UK Engineering Council. And she also have very strong, outstanding contribution that have earned her numerous award and recognition in academia as well as in her career. And her area of interest and expertise actually varies from green technology, environment, waste management, energy and environmental sustainability, as well as actively in the curriculum design and management. And we are very honored today to have her to share her insight on the topic, which is going to talk about the carbon neutral city, as well as its impact on the environment. And as you know, in the context of urban planning, a zero carbon city is the goal in many city planners that look forward. And it defined as one of the one that generate as much as more carbon-free sustainability energy as is among the users. So over 1,000 cities in the world have taken steps to actually achieve this goal, looking at the City Race to Zero campaign and a significant component of the United Nations Race to Zero campaign. While with this in mind, it's indeed my privilege, all of us, to have Professor Shanti with us today. I will hand over to Professor Shanti. Thank you.
Thank you, Prof. Chia, for a very kind introduction, quite lengthy. And of course, thank you very much to the organizer who had their trust calling me into this public health seminar, which I was informed that the focus is on climate change. So I know it's lunch hour. I hope you can still bear with me for another hour for me to share some insights on low carbon city or low carbon subjects, and also how it relates to the climate change issue, which I heard Prof. Andrew had mentioned, over and again about the progress, which is quite slow, and we hope that by sharing this, I can contribute in enriching your knowledge and experience about the low carbon city. Okay. Since my slide is controlled by the organizer, can we have the slides on, please? Can the participants? Okay. Right. This is me. I will share my slides later on. So anything to do with environmental energy accessibility has been my focus of late, not just me. Our team in our institute are working very hard. We are working together with local authorities, state governments, and also national and international partners on this area. Next. Next slide, please. Okay, next. Right. Perhaps maybe we want to ask ourselves beyond the perspective of the public health, what actually drives the agenda of low carbon? We heard so many terms about carbon, low carbon, carbon neutral, net zero, carbon trading, which some become very interested in. So one of the driver that drive the agenda of low carbon is green economy. For those who are staying in Sarawak, you know this green economy has become the new focus of the state government, not just state government, but actually we started actually aggressively in Europe when they come out with what they call a Green Deal 2050, where environmental sustainability has been the pillar of their economic activity. So what is a green economy is actually a combination of a low carbon growth, resource efficiency, and social inclusivity. Prof. Andrew had touched a lot about the social inclusivity. So I will be explaining from the context and also from the technical contribution of low carbon. Yeah. So this, of course, at the end of the day, towards achieving the sustainable development goals lah. Okay. Next. Next slide, please. Okay. So it's good to know what is the definition of low carbon. This definition is what, if we browse, there are a lot of definition, but this one I would like to share the national definition of a low carbon city. So a low carbon city is a city that implement low carbon strategies to meet the environmental, social, and economic needs. So it's not just about the environmental needs of any city, but it also includes the social and economic needs. But what important about this low carbon city is not just the definition of the city, but what is the action of the city? So for a city to really say that we are low carbon, they have to measure, they have to manage, and they have to mitigate the carbon emissions. So this is what they have to do. So basically, it's not really an easy as declaring that we are low carbon, but it has to comes with the responsibility to measure, to manage, and mitigate. So I believe this is where the challenge comes in. And this, of course, cannot be done by just one party. Next. Next slide, please. I think we are still stuck at the definition of low carbon city. Can we have next slide, please? Okay. So I hope this can be done very quickly. I don't know what is the problem with the slide taking a long time to flip from one to another. Yeah, it is. Okay, no worries. Okay. Right. So when we talk about low carbon, so I just want to share with you that low carbon does not really just apply to a city, but also to an event. Yeah, people are talking about low carbon event. People are talking about low carbon products. People are talking about, for example, one of the first low carbon laptop that has been produced is is from ASUS. Yeah? So these are the things that people talk about when they talk about the product of the low carbon. Next. Okay. So when we talk about low carbon, for those who are perhaps your first time listening to the term or knowing about the term, what we have in mind is we always feel like, oh, it's something about the air, about our atmosphere. It is actually not. Yeah. So low carbon is, if we can explain it, is a branding or that people give to actually drive the sustainability agenda. Yeah. So if we look from Malaysia perspective, this is what we can find from the criteria or the characteristics of the low carbon city. So the low carbon city has the renewable energy, energy efficiency, water consumption reduction, reduction of waste, so on. So it goes beyond just the measurement or reduction of low carbon. So why city? Because if you look at the population of the human beings, very much concentrated in the city. And from the data and the scientific study that has been conducted, city contributed, well, more or less about 80% of carbon emissions compared to the other areas. So that is why the focus on the low carbon has been pushed towards the city rather than the other areas. Next. Right. It is not really a new, like Prof. Andrew mentioned. The agenda of this low carbon has started many years ago. Yeah. So if you can see on the screen the chronology or the timeline of this, you can see that the effort has started since 1997, and there are so many documents has been established, be it at international level or national level. So if those who are interested, you can have a look at Low Carbon City Framework, which was established back in 2011. And then the latest one is National Low Carbon Cities Master Plan. And also there is very latest, like not even a year, is about the Garis Panduan for low carbon city. So these are the things that for those who are interested, you can have a look on the detailed document. Next. Right. So let's understand what makes a city low carbon. What makes a city low carbon? So when we talk about a city, we have to understand the important component in a city. Sustainable land use is one of the most important component that has to be looked at when we talk about the low carbon city. For example, in order for us to design or to turn the city into a low carbon, we have to look at what is the development, what is the plan for the city itself. Yeah. So one of the things that normally people will look at is the green spaces, or they call it urban forestry. How many green areas are allocated in that city? And then we talk about the low carbon mobility. So we know that people move around. So this is one of the major problem or major contribution to the emissions of carbon when we talk about the city is coming from the transportations. And I can see that for our country, this will be a very big challenge because of our public transportation is not at par as what people have, especially in the Europe country. So this is something that perhaps becoming a very important agenda that Malaysia is looking at if we want to really go for low carbon city. Low carbon housing and buildings, perhaps for us, we are talking about the consumptions of energy that we use to cool down the house and whatnot. But for cold country, this has become their major problem because they need a lot of heat to heat for their heating, yeah, and their daily activities. So these are the three components for a low carbon city. Next. So apart from that three components, there are energy. We are also talking about energy efficiency. We are also talking about integrated and sustainable waste management. We are also talking about green industry and services. Based on my engagement with the government agencies, local authorities, and the community, one of a very critical issue in our country is our waste management. If you look at our neighbor, Singapore, they are very good at handling their waste. Yeah. While for us, we are still struggling with the landfill. We are still struggling with finding the right system for waste segregation, incineration, and whatnot. Yeah. So perhaps you might ask, how does that waste contribute to the carbon emissions? Actually, it's about the end of life of the waste. Yeah? It's about how we handle the final stage of the waste. Yeah, because if we have a lot of landfill, what happens is that it will produce a lot of methane gas. And as we know, methane is one of the contributor for the carbon emissions. So this is something that people are coming up with circular economy so that we can divert our waste, we can reuse, reduce, and repurpose. Next. So apart from the six components that I mentioned just now, this is very much less frequent, people mention when they talk about low carbon city, is on the sustainable communities and social equities. So it's not just about low carbon, renewable energy, waste per se, but we are also talking about sustainable communities and social equity. What we are talking here is that for us to really go for a low carbon city, we have to be as inclusive as possible and making sure that every level of community, no one is leaving behind. So this is also another important indicators or component that we will measure and manage when we're talking about low carbon city. And of course, climate governance and climate adaptation is also very important enablers, in fact, in order for us to drive this agenda. I give you a few examples from my experience working on the low carbon city. We have a lot of departments around us, and one of the challenges is to have the joint office or joint development office to bring the agenda together. Because when we talk about low carbon city, it's very integrated. So there is no one office that can handle the agendas, the plan, monitoring and whatnot. So before we want to talk about the low carbon implementation, the first and foremost is to have a clear low carbon or the climate governance in our in our organization or in any city. Next. Right. So what is our progress right now for low carbon city? So Malaysia actually has made a pledge, yeah, and our target is to go to what we call it carbon neutrality. So it's actually beyond low, yeah. So when we talk about carbon neutrality, we are saying that whatever that we produce will be the same amount that we absorb. So this is what we mean by carbon neutrality, and the target is by 2050. And we also have the commitment to the global methane pledge, where we are not just looking at CO2, carbon dioxide, but also looking at the methane reduction amount as part of our commitment. So at international level, Prof. Andrew mentioned about COP, Conference of Parties, every year. All the country leaders, they all gather in one place and everybody will update and again, telling the international community about their pledge. So for now, Malaysia pledge towards low carbon is to reduce 45%, 45% in 2030 compared to 2005 level. So it is still a long way to go, but we have to really work hard to achieve the 45%, because by then we will be seen as the country who just making an empty promise. So we don't want to have that. There are also a lot of efforts when we talk about from the energy perspective. For Sarawak, we are quite fortunate because our renewable energy share is currently about 60 to 70% coming from renewable energy. So that's why Sarawak is quite positive about their intention to become net zero by as early as 2030 or to 2050. So a lot of effort has been ongoing, and it is not just about coming out with the renewable energy, but also coming out with energy efficiency. So I believe you all have seen things like energy rating. There are star rating performance on the equipments. Yeah. So our government has made it compulsory for equipment like washing machines, refrigerators, and air conditioners. So sooner or later, you're going to see in our market all of these three equipments will have its energy rating. So of course, the best one you have to go is for the 5-star rating. And we also want to commit for 100% of cars by 2030 to be electrified, CNG, LPG, liquefied petrol gas, or biofuel fuel vehicles. So it's kind of a very ambitious pledge that we made at a national level. Next. So what really drive this agenda, I believe most of us has heard about this Paris Agreement. So it's all started from the Paris Agreement back in 2015, where the scientists realized that, our Earth can no longer be affected by the increase of the global warming effect. And it will cause a lot of problems to everybody in this world. So everybody start to making the pledge, and it's all started at the Paris Agreement in 2015. So if you can see at the map, you can see there are different type of commitment that these countries made. But of course, the one in the I would say in the compulsory list, those who are in the compulsory list are the one who started the industrial revolution earlier. Yeah, it's a country like America, Europe. These are the country that has emitted a lot of carbon, CO2 in the atmosphere. So these are the country that is actually under the, I would say, under the MAS list, under the MAS list and to curb their CO2 emission. Next. So just now I mentioned about what is the driver in Europe. Europe is going all out for this. In fact, they are trying to really making sure that whatever the economic activities, whether in Europe or among their partners or business partners, are actually aligned or committed, to the European Green Deal 2050, because they have a very ambitious plan to be achieved by 2050. Next. So these are the list of the policy, for those who are interested to look at the climate action policy, to look at the environmental sustainability policy, to look at the national energy policy. But of course, Sarawak, we also coming up with our own policy to accelerate the transitioning towards the agenda of the net zero, which is something related to the low carbon agenda. Next. So this is an extract from the Low Carbon Cities Framework for us to understand what sort of effort or initiative that we have to take, in order for us to move towards a low carbon city. So this framework actually quite comprehensive, I would say, where they divide the elements of the greenhouse gas or the CO2 or some people call it GHG, some people carbon reductions, into 4 elements, which is the urban environment, urban infrastructures, buildings, and urban. So actually, for those who want to start with the low carbon journey, they can refer to this framework, and then you can see how actually the indicators or the performance criteria are being measured, from these 4 elements. Next. And this is the National Low Carbon Cities Master Plan, a recent version of the guidelines, I would say, or a master plan guidelines that helps for any city or even any organization that want to go for low carbon can refer to these guidelines. So it's more or less similar to the low carbon framework just now. But here you can see that they are focusing on the 4 focus sectors, the spatial planning and development, the transportation, the energy, as well as the waste. Next. So talking about the challenges, talking about the challenges of going into this low carbon, we can see that the challenges come from I would say six components that we can have a look at. The importance one, based on my engagement, with the stakeholders, the first one is the governance and implementation framework. This is sometimes very difficult because the lack of the capacity building. We still are very lacking on the expertise on these low carbon areas. And community participation is also something that is regarded as one of the key drivers in transforming any city into the low carbon. Next. So talking about our state in Sarawak, of course, everybody is familiar with PCDS, and we can see that environmental sustainability is one of the pillars that has been a focus of PCDS. Next. So this is where we can map the effort of the low carbon, the effort of the climate action, the effort of the circular economy, which is one of the important component in the low carbon being specified. Very focused in the green economy and the blue economy initiative. So that is why if you talk about from the state point of view, the agenda of the net zero or the low carbon has become very, very important. Next. How do we understand the context of the low carbon by understanding the carbon offsetting and nature-based solutions? So how do we make our city low carbon? Just now we're talking about the framework, we're talking about the indicators, we're talking about the component. But actually, it all down into two things. When we want to talk about the measurement, it's about the carbon source and the carbon sink. The carbon source is where the source of emission comes from, and the carbon sink is where the ability to absorb the CO2 emission comes in. So when we want to understand about the carbon offsetting, we are looking at two aspects actually. One is about the technology aspect, and one is about the nature-based solutions. So as you can see on your screen here, this is actually, we are talking about the nature-based solution. That is why, regardless of what technology that comes in, nature is regarded as one of the base solutions. So we are looking at our forests as the carbon sink, and also our mangrove, our mangrove area, if we are talking about the source to absorb the CO2 or to absorb the carbon emission in the atmosphere. So this is the context of the carbon offsetting. But here, what is appearing on your screen is actually looking at the nature-based solutions. Next. And when we talk about the technology, how to reduce the carbon emissions. So the reduction of carbon emission can be also regarded as the carbon offset. The carbon offset terms to explain about how we can absorb or how we can get rid of the carbon emissions in the atmosphere. So these are the multi-pronged approaches that people are using right now in the effort to go towards low carbon, such as the renewable energy projects, the energy efficiency initiatives, and perhaps you have heard about the soil carbon sequestration. This is something that is very interesting from the research point of view, where there is an effort, a lot of R&D going on to see how the carbon can actually be stored in our soil rather than being in the atmosphere. Because if it's in the soil, we don't have any issue. It causes issue when it is actually released to the atmosphere. Next. Right. So from the industrial point of view, perhaps we heard about the carbon offset, the carbon trading and whatnot. So this is just one of the example how it is done. From the industrial point of view, we know that a lot of industry are producing carbon as their emissions. So what they do is that if they do something to reduce the emissions or to handle the CO2 emission, what happens is that this is what we call a carbon offset, and they are offsetting the carbon emissions that they have, and what would be the return, of the effort of emissions is that they can get a funding, they can get some sort of incentive, coming from their investor or coming from the government, and that incentive is known as a credit. So this is what when people mention about the carbon credit, people talking about the emission trading ETS, emission trading scheme. So this is how people are trying to manage the carbon emissions from the industrial point of view. Next. So why is it so important to go for low carbon or carbon neutrality? Next. I believe Prof. Andrew has mentioned a lot, or other speakers have mentioned a lot about the effect of the climate change. So I will go very quickly on this part. This is coming from one of the source from the climate government agencies, where they have stated that 2023 was the world's warmest year on record. Next. And some newspaper cut on the situation of the climate change at the moment, the global warming. Next. And here we are talking from Malaysia point of view. When we talk about the climate change, actually there is an index that people has established to rank and to measure the effort on the climate change by every country. It is known as Climate Change Performance Index, and Malaysia is not doing too bad. We are ranked as 59th in the current CCPI. So it is assessed based on the 4 categories: your carbon emissions, how much renewable energy that you have in your country, how do you use your energy, so we are talking about energy efficiency, and the climate policy. So we are not doing too bad when we talk from this ranking point of view. Next. Okay, so this is, I forgot to put in my slide, how big is 10 ton CO2, if we can see it physically. It's quite huge. But on average, this is the statistic and the calculation that has been done. On average, in Malaysia, every one of us, we are producing at 0.6 ton CO2, on average, so per person. So this is the amount that basically we have to reduce, and maybe you all have heard about the carbon footprint. This is something that we all can start to look at and start to educate ourselves and people around us. So this is just an average value that people calculated from for Malaysia. Next. This is if we want to compare ourselves to others, in terms of the CO2 emissions, how much do we produce? But of course, this calculation has to be somehow need to be recalibrated to the GDP of the country as well. But this is when we are talking about the total emissions. Next. Impact of climate change, I think I would like to go very quickly on this slide, because I believe most of you have have been briefed about this by earlier speakers. Next. So this is the thing that I would always try to explain to the people so that they understand. Climate change is not just about our how to say, our temperature. Our temperature is getting hotter and hotter. But we talk about the climate, it goes beyond beyond the temperature. So anything to do with the climate change, the shifting of the rainfall, the extreme events, the sea level rise, it will not just have an impact on the environment, but also the human health. This is perhaps one of the things that in public health, the significant and the important role of the people coming from the public health to understand this and be together in this low carbon agenda. because at the end of the day, we are still believe that, as the scientists mentioned, that one of the biggest culprit is on our carbon emission or GHG emissions. Next. This is something that I always love to show to the students or to the to the public on the impact, yeah, so that we know it, even though we are talking about 1 or 2 degrees, but a long-term impact of it is non-reversible. Yeah, as we can see that anything that go beyond 4 degrees and 4 degrees Celsius, most of the world will become uninhabitable. So I don't think we want that for our future generation. So I hope that we can really do something about our effort in dealing with this carbon emission. Next. So this is coming from one of the, I forgot, sorry, I didn't put the reference there, but I can share later on the observed widespread impact on the climate change, yeah, to the not just the environment, but like I mentioned, to the flora, fauna, and also the human beings, and also the biodiversity and ecosystems. Next. Okay, next, because we only have like 7 minutes before. Okay, I will just keep on this, yeah, but the slide will be shared with you so you can have more time to have a look at this. This is just the impact, yeah, and or the why we have to go for the low carbon or carbon neutral. Next. Next. Next, we just skip this part, yeah. Okay, so this is again why the previous slide, yeah, as you can see, it mentioned about the hotspot in a city where the CO2 emission comes from. Yeah, so this is a good reflection for us to see in what way we can contribute to reduce the CO2 emission. Next. So carbon neutrality impact on the environment. Next. So this is when we want to talk specifically about the impact on the environment and health, actually. Okay, can we stop there? So this is something that I have summarized, yeah, from the literature, from the reading, from the guidelines, from the conversation with the people. We can summarize it into these 4 main impact, yeah, on the environment and health, yeah. So when we talk about going for low carbon, we definitely will improve the air quality. It will definitely mitigate the climate change. It can help us to preserve the biodiversity, since we are talking about creating a better environment, more green spaces, and last but not least, to enhance the public health by introducing a cleaner air, a good lifestyle, as what we refer to as a low carbon society, which Japan is really looking at the moment. Because when we talk about the low carbon, it's not just about the technology, it's not just about the industry, but the change of behavior of the people when we manage our lifestyle. Yeah, the transportation, we walk more, we drive less, we throw the waste less, and things like that. Yeah, next. Strategies for achieving carbon neutrality. Next. There's a lot of strategies that people do right now. This one also I'll go very quickly. As you can see from your slide, this is coming from the renewable energy and technology. And Sarawak is going all out for the hydrogen economy, because this is one of the proven technology that can really drive and accelerate the agenda of the low carbon. Yeah. So when we talk about the renewable energy, there are many options that people are doing right now. Of course, Sarawak has going for hydropower for so long already. That's why we are very fortunate to have our energy share is around 60 to 70%. But at national level, we are not doing so bad. We are currently about 30% of renewable energy share when we talk about Malaysia perspective. Next. Yeah, this is again diverse approach to carbon offset. Next. These are the emerging technology that people use. I would like to grab your attention to what we call a carbon capture and storage. This is very, very new. Sarawak has started this with their Petros, Petros and Petronas is also doing it, where what they do is that they inject back the CO2 into the to the reservoir that has not that has been used, meaning to say that all the gases has been taken out. So they are using that reservoir and inject back the CO2 into that reservoir. So that is one of the carbon capture and storage technology that people are talking right now. Next. Of course, like I mentioned, hydrogen power is one of the promising technology. And also we're talking about sustainable agriculture, where we are talking about regenerative farming, where we want to minimize the emissions of greenhouse gas or CO2 coming from agriculture activities. Next. This is sharing few real-world implementation of carbon capture technology, what people do all around the world to capture the carbon dioxide. Yeah. Next. So the role of individual and communities is very important in order for us to really go for low carbon, because like I mentioned just now, education, awareness, and capacity and capability building and change of behavior is what we need right now, very critically. Next. Again, the practical example like I mentioned, going for energy conservation, what are our transportation habits? Next. Waste reduction, of course, and sustainable consumption. So this is something that we can reflect on our daily activities, on our community activities, how we can at least contribute to this, if not, if perhaps we cannot do it drastically, but something that we can do at our level and our capacity. Next. So perhaps 4 steps to balance decarbonization goal with the workplace well-being. I'm not an expert of this, but I would like to share, since a lot of you perhaps are into this, health context, the workplace well-being. So this is something that I found out, where they have this campaign going on, to relate the low carbon or the decarbonization with the workplace well-being. So this is something that we can share with our friends and a colleague. Next. So again, Malaysia's path to decarbonization, we are committed, and we have come up with what are the targets, which is you can find it anywhere if you Google it on the internet. But basically, the baseline or the important thing that we want to achieve is the reduction of 45% of the CO2 emission from 2005 by 2030. Next. So this is an important roadmap just established recently to drive the decarbonization or the low carbon agenda for national level. Next. So last but not least, I would like to share very briefly about what we do in UNIMAS in the campus towards a low carbon campus to imitate the low carbon city. So this is our roadmap. For those who are interested, I'm gladly to share the roadmap with every one of you. Next. This is the framework of the roadmap, where we have the 6 focus area. Next. And this is the journey that we have planned and formulated since last year. So we have the immediate goals, what are the things that we want to do. We have the short-term goals. And next, we also have our long-term goals, and we also have our target by 2030. So these are the things that we want to start with our own campus. And hopefully we can get a lot of participation from everyone in the campus and outside the campus to make this thing happen. So I believe that's the last of my slide. Thank you very much for listening.
Thank you very much, Professor Shanti. Now, I'm sure that the topic is very interesting, and we have few of the questions that we open, and some of the questions actually from the participant. One of it, they are actually saying that given the challenges in integrating new low carbon technologies with existing urban infrastructure, what are some of the effective strategies that or case study that that city can adopt and overcome this barrier while transitioning into a low carbon mobility in housing? I hope that you can catch my question.
Okay. This is talking about the quick win solution, right? If I'm not mistaken, maybe I can. Yeah. Different city have a different quick win solution. Yeah. For example, in Johor, yeah, in Johor, they also want to go for low carbon city, because they are dealing with a lot of issue with their urban planning, with their land development. So that is where they started to come up with a lot of policy that really drive the agenda of greening their land development. So that they start to develop what they call a green parks, green industrial park. They come up with a lot of regulations on what not to do on the green building. For example, they really go all out. They started with their own local agencies. On green building index or green building certification. So this is what Johor is doing. For us, yeah, I believe we had this project with Bintulu Development Authority recently. So their quick win solution from their point of view, because they have a lot of industry. So they will go to the industry first, and at the same time, of course, they will not ignore the community, but a lot of focus is going on how to make sure that the industry reduce their carbon emission. So if you look at our national context, transportation and building, this is something that we are still at a very early stage, even though we have been talking about this quite often, perhaps because our society, our community is not really well versed about this and being empowered. Because if you look at the country like Europe, those who drive the mobility, the low carbon mobility and low carbon housing are the community, because they are the one who choose their transportation mode, or how they want to move here and there. But having said that, of course, one of the reason is that because they have been provided by a good public networking and transportation. So I believe this is something that our government has to look at. And in fact, in Sarawak, I'm not sure when our ART will be ready. Hopefully that can be one of our nilai, our catalyst or driver to drive this agenda.
And then that the other thing that coming back to the story about, because when we talk about looking towards the new low carbon, of course, one of the things that we want to do is call it community engagement. Okay, community engagement. So how do we actually think that what are the successful story or method that we can actually foster this concept, where we get a very strong public support, participation from the community, all those things. So in the context of developing country itself, how does this actually, help us to, with all these limited resources, that kind of thing. So I think back to the story about community engagement. How do we actually, promote this concept with a very limited resources? And then I think that this is a very valid question.
Yeah. When the okay, if you look at the success story in Europe, when they want to start with the low carbon agenda, it's normally driven by the council or local authority.
Yeah,
so
correct.
so the one who actually comes and join hands in hands with the local authority are the leaders, the community leaders or the community themselves. So they are being empowered to be part of we call it the low carbon committee. So these people are driving the agenda, and of course it is facilitated by the local authority themselves. So that is one of the secret recipe that they use in Europe. In Japan, also the same thing. they use the SDG as their as the main driver, and then they choose climate change as their what to say, their maturity or their particular concern. So with that, they get the community to lead the project for low carbon reduction. For example, we talk about the 3R, 4R, 5R, or even now 9R. So the one who champion it is the community. In fact, they have a very nice community recycling center that people are invited to come and contribute their ideas into the repurposing of the waste, into, you know, managing and handling the recycling of the waste. So I always believe that by empowering the people is one of the way that we can move forward. In Bintulu, where we recently had an engagement with the community there, we were quite surprised to see that they are very into the low carbon mode if they really understand why we are doing it and what is in it for them. So I believe it's the communication, the empowerment, and also to put them as the driver of the agenda.
What do you think that, because this is a public health seminar, I think that a lot of, the audience in today's seminar, we call it from the public health, whether it's going to be a public health practitioner or, you know, all these people. What can a public health people actually come in to, you know, support this concept? Because it might not seem very clearly it's about public health, but in your opinion, what would be the way that we can come in and, you know, support the whole concept of this so-called low carbon, you know, city as well? I mean, engagement with the community is one of the platform lah.
Yeah. Some people only think about low carbon as environmental agenda, energy and environmental agenda. Yeah, I think that is why it is a bit isolated in a way. Perhaps we have to really, like I said, really make it clear that the end goal is, you know, making life better. You know, so it's very much about the health and wellness of the people that we are concerned about when we talk about the low carbon. And this is where I think we have to have this conversation or the way that we can properly explain and connect the story between the low carbon and the public health in a more comprehensive and interesting way that people will understand.
True.
Yeah,
I think that if we were to look at the context of health, maybe people will be a little bit more, you know, aware and say that, oh, this actually can affect, you know, the health eventually in that sense. So we will move on and, you know, go through that, you know, go in hand by hand, because as you say, it has to be a whole community going in, not only looking at the government, you know, top-down decision, that kind of enforcement and so forth. And then we have one last question. It says that, can we apply this general guideline for carbon neutral for every household? At the household level, what should we actually talk about it when we talk about carbon? Because as I mentioned earlier, it should be from the small and then slowly, you know, get into something more the whole community base.
Yeah, thank you, Prof. Actually, in UNIMAS, we are developing an app. We call it 4C apps, where it's actually a carbon calculator for our students. Yeah, where we want to educate our students. Whatever that you do, there is an impact to the carbon emissions. So because people always think that carbon emissions is just for industry, but actually we are the one who also contribute to it. So we have to understand where the carbon comes from. We have to educate ourselves what would be, you know, in terms of the options that we have in our daily activities. You know, the food that we eat, the clothes that we wear, the things that we throw actually affect the carbon emission. Yeah. So we can start with having if educating ourselves, and actually by having that, you know, the carbon calculator tools, it helps us to understand how we actually can calculate. Some of the organization, they actually put the carbon calculator as the KPI of the staff. So
I see.
you sort of make a
That is good.
commitment to
Yeah,
reduce
I
your
think that is
carbon
good.
emissions, year by
I
year,
think that
or try to control it, or to do your own offsetting, for example, right? Energy efficiency, I think, is nothing new. We talk about, how to preserve energy, off your aircon, off your noise not in use, and things like that. The waste, I always talk about the waste because that has been, our, even when we talk to the council also, we still have yet to solve this issue. So this is something that, at the household level, we can start with.
Thank you very much, Prof. Shanti. I think that we have a very good session today with you. And on behalf of the organizer, we would like to thank you for your time. Because this is lunch hour, I hope you have taken your lunch. And then with that, we would like to, thank you for your time. And we hope that in future we can have another engagement with you to talk about all these things. And thank you very much, Prof. Shanti.
Thank you. Thank you.
Okay.
Thank you, Professor Dr. Chia Wai Lian and the respected speaker for the very informative sharing. Ladies and gentlemen, before moving on to the next presentation, we will take a short break for lunch and prayer. We will resume back at 2 p.m. See you later.
Sarawakku sayangku, kebanggaanku selalu, amanahku selamanya Sarawakku. Rakyat bersatu padu, pemimpin mengambil tahu, menuju maju Sarawak maju. Kita anak Sarawak, sama-sama jaga Sarawak. Kita sayang Sarawak, sanggup berkorban untuk Sarawak. Oh ha, mari raungkan bersama. Membara di dalam jiwa.
climate change isn't just about melting icebergs or hotter summers. It's a global issue that affects every aspect of our lives, from our health to our jobs and even where we can live. As our planet undergoes these dramatic shifts, it's crucial for us to understand how these changes are impacting us directly. Health concerns. With the planet heating up, we're seeing more and more heat waves. These can lead to severe health problems like heat strokes and, in extreme cases, deaths. Warmer climates also create ideal conditions for mosquitoes to thrive, leading to the spread of diseases like malaria and dengue. On top of that, the quality of the air we breathe is deteriorating, causing a rise in breathing problems and aggravating allergies. Food and water scarcity. Our changing climate is having a big impact on farming. Rain isn't as predictable as it used to be, and rising temperatures can make it harder for crops to grow. This means less food and potentially higher prices. The water situation isn't great either. Glaciers, which are vital freshwater sources, are melting, and weird rainfall patterns are affecting river levels. Additionally, our oceans are becoming more acidic, which messes with the marine food chain, especially fish populations. Economic impacts. People's jobs are getting hit hard by climate change. Fields like agriculture, fishing, and even tourism are feeling the pinch as nature becomes less predictable. Food prices are going up because there's less produce available. And when extreme weather strikes, the damage to roads, bridges, and buildings can cost a ton to repair. Threat to coastal habitats. Our beautiful coastlines are under threat. With rising sea levels, beaches are eroding, and we're losing vital habitats like the protective mangroves and colourful coral reefs. These aren't just picturesque spots. They play a huge role in supporting diverse marine life and protecting the coast from storm surges, displacement, and migration. Imagine being forced to leave your home because it's either underwater or too dry to live in. That's the reality for many as seas rise, swallowing up coastal areas and even entire islands. Meanwhile, violent weather events, from hurricanes to floods, are uprooting entire communities. And in some places, constant droughts and expanding deserts mean people have to move elsewhere to find water and resources to survive. As the planet continues to experience these profound changes, the ripple effects touch every corner of our lives. The challenges presented by climate change are not just environmental, but deeply personal. They affect our health, our food, our livelihoods, and even our homes. Yet, understanding these impacts gives us the knowledge and the motivation to make a difference. Every effort counts, and by working together and making informed decisions, we can pave the way for a more sustainable and hopeful future.
Don't forget to subscribe.
The COVID-19 pandemic has given us a glimpse of a possible future. It has shown us that when health is threatened on a global scale, our way of life is brought to a standstill. But threats to global health will grow, and the disruption that follows, if we don't take action to address climate change now. The Lancet Countdown brings together 120 leading scientists and health experts to track how the world's changing climate is impacting on our health. This year's report reveals the most concerning outlook yet. Climate change is fueling a health crisis that threatens every continent, country, and community. No one remains untouched. From small islands to big cities, climate change has driven an increase in the number and intensity of extreme weather events. Heat-related deaths in people aged over 65 have increased by more than 50% in the past 2 decades, with older people in Japan, Northern India, Eastern China and Central Europe most vulnerable. People living in countries such as Bangladesh, South Africa and Ethiopia face a future of undernutrition. Warmer temperatures, flooding and drought put food security at risk. People's exposure to wildfires has risen in 128 countries, compared with 15 years ago, aggravating heart and lung conditions. Recent fires in North America and Australia have claimed lives and livelihoods. Climate suitability for the spread of infectious diseases such as dengue and malaria is rising. Climate change, coupled with other environmental harms, could increase the risk of new pandemics. Climate change impacts us all, but the vulnerable in our world will feel its health harms most acutely. A brighter future is possible. Responding to climate change by reducing global carbon emissions will bring immediate health benefits through cleaner air, healthier diets, and more livable cities. 3 million people die prematurely each year from heart and lung diseases linked to ambient particulate air pollution. Cleaner air inside and out would prevent a large number of future deaths. A further 1 million deaths in 2017 were associated with eating excessive red meat, a risk factor for diseases such as cancer and heart disease. Promoting healthier diets around the world would save millions of lives, while reducing significant emissions from livestock. Time is short. Our failure to respond to climate change is damaging the health of the world's 7.8 billion citizens today. If we don't act now, we will condemn each other to a future of climate-induced health shocks. The global pandemic has presented the circumstances from which to reset. Responding to these converging crises offers a triple win: protect public health, promote sustainable economies, preserve our planet. We must now choose the world we want to live in.
Our world is changing. Over the years, in an effort to expand, we burned enough of our planet that we changed its own climate. As we grow in numbers, the threat of climate change grows as well, affecting on our health in particular. WHO Southeast Asia region is a densely populated and highly vulnerable area. The warning signs are showing already. While the mainland suffers from heat waves, vectors are found at higher altitudes. Extreme weather conditions pose serious health impacts and threaten to burden our health services even more. This is no longer a problem for the future. This is happening right now. And the question in front of us is, what can the health sector really do? We need to start by educating ourselves, each and every one of us. A healthier population will be far more resilient to climate change. Health system as a whole also needs to be reinforced and replanned by integrating the risks of climate change in their very building blocks. At the forefront of a health system is its workforce. We need a well-trained health workforce that is able to respond effectively and quickly. It is important to understand and acknowledge different vulnerabilities in each region. We need to carry out extensive research to understand the local impact of climate change. Climate data must be integrated into health information systems and disease surveillance. Health sector as a whole can lead by example and reduce its carbon footprint. Healthcare facilities should not only be environmentally friendly, but also climate resilient. All sectors that have a direct impact on health need to come together in order to bring actionable change. We need to integrate climate change risks into emergency preparedness and management program. Both current and future climate risks should be considered while designing health program. Identifying resources and mobilization of funds is also needed. For all this to happen, we need strategic planning backed by a strong leadership. A new wave of awareness is evident throughout the region. Climate change is now a critical factor in national level action plans. All countries have actively started training frontline health workforce. Critical weather data is now a key factor in the control of climate-sensitive diseases. Integrated disease surveillance has been initiated in one country. New heat health action plans and early warning systems are in rapid development in 3 countries. We've seen multiple sectors working together to establish disaster management units and green hospitals in 5 countries. The World Health Organization and its partners have so far been successful in generating external funding for 5 countries to improve their levels of preparedness and adapt to climate change. These brilliant examples testify towards a new wave of awareness and responsibility. But a lot needs to be done, even now. What's important is not what's gone, but what remains on this blue planet. We know the solutions. We all have the power to change. It's time to come together and become the change. So, what are we waiting for?
Much of the conversation around climate change centers on things like lowering carbon emissions, which is obviously critical. But we think the public health response to climate change should be a larger part of the conversation. Whatever we do moving forward to address climate change, there's no avoiding the fact that we still face consequences. That sucks, but we can soften the blow if we prepare ourselves. And that's the topic of this week's Healthcare Triage. Mitigation and adaptation are major components of public health preparedness, and both are relevant to a health-focused approach to climate change. Mitigation mainly encompasses efforts to slow or reverse climate change, which will depend largely on policies made outside of the public health sector, but which will have obvious benefits for our health. Adaptation, however, is where public health efforts should really shine. In 1994, a committee of health-minded professionals got together and developed the 10 essential services of public health. Borrowing examples from a paper published in the American Journal of Public Health, we're going to cover the role of each of these public health services in addressing the many health-related problems that accompany climate change. The first essential service is to assess and monitor population health. In the realm of climate change, this means tracking changes in health and disease trends on a warming planet. The second service is to investigate, diagnose, and address health hazards and root causes. This means investigating disease outbreaks that result from climate change. This includes waterborne diseases, foodborne diseases, and diseases spread by vectors like mosquitoes and ticks, all of which are increasing as the planet warms. The third service is to communicate effectively to inform and educate. This requires public health officials to learn and practice effective communication techniques to keep the public aware of and informed about the health effects of climate change, and maybe focus on getting this information to the public via routes like, YouTube channels. The fourth service is to strengthen, support, and mobilize communities and partnerships. This one's about collaboration, nurturing relationships with both industry and community, and providing needed support for their efforts to create and implement climate solutions. The fifth service is to create, champion, and implement policies, plans, and laws. A climate-related example of this one will be the creation of plans such as a municipal heat wave preparedness plan that is ready to go in the case of a severe heat wave. The sixth service is to utilize legal and regulatory actions. This one gets a little tricky because it's a balance between creating healthy conditions and respecting people's autonomy and interests. We became pretty familiar with this tricky relationship during the COVID-19 pandemic, and the same tensions start to arise in matters of climate change. Legal measures taken to protect health on a warming planet may not always be warmly received, and it'll take work to find the right balance. The seventh service is to enable equitable access. This step requires that health services be provided in an effort to prevent or address the health effects of climate-related disasters. Careful consideration will be necessary to ensure that these services are provided equitably, not just to rich nations and rich neighborhoods who will already suffer less from climate change, but to nations, neighborhoods, and people who traditionally have lower access to healthcare and far fewer protections against disaster. The eighth service is to build a diverse and skilled workforce. This mainly refers to the training of healthcare providers that are educated about the relationship between health and climate change and have the skills to educate their patients about that relationship and to identify and address the health issues that individual patients face as the planet warms. The ninth service is to improve and innovate through evaluation, research, and quality improvement. This one might be our favorite, mainly because it calls for more research. We absolutely need more research to understand the health effects of climate change and the best ways to address them. And finally, the 10th service is to build and maintain a strong organizational infrastructure for public health. A strong public health infrastructure is critical to our ability to respond appropriately to any public health crisis, climate change included. Based on our pandemic response, we've definitely got some work to do here. These 10 services provide a foundational look at the important role of public health in the climate crisis, but each service will need to be multidimensional to address the various needs of many different populations. Public health professionals and medical service providers must be ready to adapt policies, information, treatments, and other services based on who they are addressing and where. For example, some countries and even different regions within countries will be facing different threats based on factors related to their specific location and resources. Some areas of the world will be facing issues related to extreme storms and flooding, while others will be grappling with extreme drought. Other areas will have many resources, while people from other areas will sorely lack the resources necessary to cope. To ensure health equity across these populations, particularly those lacking resources, these kinds of differences absolutely have to be accounted for. This will require that we look at local data to determine area-specific issues and that we partner with local people and organizations to fully understand their needs. Building Resilience Against Climate Effects, or BRACE, is a program from the CDC that assists in the development of public health strategies for communities to prepare for the effects of climate change. The program has 5 basic steps: anticipate climate impacts and assess vulnerabilities, project the disease burden, assess public health interventions, develop and implement a climate and health adaptation plan, and evaluate impact and improve quality of activities. Some of the program's recommendations include incentives like tax breaks and grants for positive climate actions, and awards for work and/or innovative solutions to address climate problems. In areas where extreme heat is or will be an issue, the program recommends tree planting programs that'll help cool cities, retrofitting public buildings with improved cooling technologies, and updating building codes to include heat mitigation strategies. In areas where water quality is compromised, the program recommends partnering with water utilities and resource managers to fully understand an area's vulnerabilities and base intervention and adaptation strategies on those specific needs. Likewise, in areas facing air quality issues, the program recommends partnering with local air quality managers to assess the risks and form appropriate strategies. Our understanding of the potential health effects of climate change are still evolving, but that's no excuse for health officials to be hands-off. Reacting to public health threats as they evolve, think global pandemic, is part of the job description. And one thing we know for sure is that a warming planet is a major public health threat. Hey, did you enjoy this video? You might enjoy this previous video on the inequities of climate change. We'd appreciate it if you'd like the video and subscribe to the channel. Maybe even go to patreon.com/healthcaretriage, where you can help support the show and make it bigger and better. We'd like to especially thank our research associates, Joe Sevitz and Edward Lillaholm, and of course, our Surgeon Admiral, Sam.
Hi, my name is Mighty Fine. I'm an expert with the American Public Health Association, and today we're going to talk about climate change. In October 1998, Hurricane Mitch hit Central America, causing the deaths of over 11,000 people, along with massive destruction to property and infrastructure. Some people survived the storm only to die of cholera, malaria, and other preventable diseases, because when the health infrastructure broke down, diseases hit harder. This is a devastating example of how extreme weather can affect public health. And unfortunately, major weather events like Hurricane Mitch are becoming more common because of climate change. In the last several hundred years, people have been burning more and more fossil fuels. This releases an excess of greenhouse gases like carbon dioxide into the atmosphere, which trap heat and cause global temperatures to rise. Worldwide, this is causing a shift in the average temperature and weather over many years. In other words, changing the climate. And these shifts will affect our health, environments, and the way we live. Higher temperatures cause ice caps to melt and sea levels to rise. They also promote water evaporation and thus rain cloud formation, leading to more frequent flooding from rainfall. And as we saw with Hurricane Mitch, extreme weather like flooding and hurricanes will directly cause injuries and deaths and have other long-term effects. Like if flooded roads or downed telephone lines disrupt people's access to treatment and prescription drugs, that can worsen pre-existing conditions that need ongoing care. But that's just one aspect of how climate change can impact public health. As temperatures rise, researchers predict heat waves will grow longer and more frequent, leading to higher numbers of heat-related deaths and illnesses, like among immigrants who travel to the U.S. for seasonal farm labor. Folks in agriculture are already 20 times more likely to die from heat illnesses than any other industry. The increased heat and higher carbon dioxide levels also promote plant growth. That sounds like a good thing until you consider the more plants means more pollen and extra bad allergy seasons, which can also impact chronic conditions like asthma and respiratory illnesses. And this isn't a problem for the future, it's already happening. From 1995 to 2011, allergy season across the U.S. extended by up to 27 days due to increased temperatures. Warmer climates can also increase the abundance of fleas, ticks, and mosquitoes. So more of these critters means more opportunities to catch the vector-borne illnesses they can spread, like Lyme disease, malaria, West Nile virus, and plague. Higher temperatures and heavier rainfall will likely also increase the quantity of bacteria growing on our crops. That can make outbreaks of foodborne illnesses more common everywhere. And those same temperature changes and major weather events will disrupt the food chain distribution, potentially causing significant food spoilage and driving up costs. Limited and expensive food will increase rates of food insecurity, which is a lack of consistent access to enough food to live a healthy life, something that already affects almost 14 million U.S. households. Not to mention, these weather events can be so severe that they drive people from their homes, creating environmental migrants. In 2020, 31 million people around the world had to flee their homes because of weather-related disasters. In the U.S., the Biloxi Chiptamacha Choctaw tribe already moved once to the Ile de Jean Charles to avoid persecution. But because of coastal erosion and inadequate governmental action, they had to move again. All of this will have an impact on people's mental health, whether it's from the ongoing stress of a longer allergy season or the trauma of losing your home to a hurricane. Ultimately, climate change will affect everyone's well-being to some extent, and vulnerable groups most of all, like people with chronic conditions, older adults, and children. That's why we need to take action now to lessen the negative impacts of climate change. Planting trees in urban areas, expanding telemedicine for improved access, and prepping our homes for extreme weather are all ways we can build a more resilient society. Climate change is happening right now, but together we can control how much it affects our nation's health. Check out the Center for Disease Control's Climate Effects on Health and the APHA website to learn more. Thanks for watching. This video is a part of a series created by Complexly and the American Public Health Association to shed a little light on the important work that public health does. To learn more, visit apha.org.
In my village, the signs of a changing climate are everywhere. But what's not as visible is the link between climate change and our health. Warmer temperatures and more extreme weather are creating ideal conditions for disease carriers like mosquitoes. As a result, we're seeing more outbreaks of malaria and dengue fever. More people are also getting sick from contaminated food and water, which is more common with all the recent flooding. Intense heat waves and more frequent disasters are especially hard on some members of our community. And on top of all of this, climate change is also making it harder for us to grow healthy food. But there are solutions. By educating our communities, we can take steps to improve health. Eating healthy food, providing access to clean water, and improving hygiene make us more resilient to disease. We can work together to strengthen our health systems by ensuring hospitals and clinics are built to withstand extreme weather, making sure health workers are well trained and can respond to rapid surge in need, and including climate change in health planning. We must work with our partners in other sectors to develop early warning systems so we can respond quickly to disasters and disease outbreaks. And as our people face increasing mental health challenges, As climate change intensifies, we need to improve support systems to keep everyone safe and happy. With good planning and strong leadership, we can provide better care for our people. Let's work together to create a healthier future.
Tarian ini dinamakan Kanjet Ngeleput yang berasal dari suku kaum orang Ulu. Tarian ini menggambarkan seorang pemburu yang tengah memburu di dalam hutan.
Tarian ini merupakan tarian suku kaum Iban. Ia sering dipersembahkan pada hari perayaan Hari Gawai Raya. Salah satu ragam yang kita selalu gunakan dalam tarian ini adalah bunga ajar.
Don't you let 'em get you down. And to learn to love me. That's why I'm talking to the girl in the mirror. Whoa, like even if you're down, better get up. Whoa, 'cause every setback's just a setup. Whoa, for something just a little bit better. Oh, I'm talking to the girl in the mirror, 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 girl in the mirror. I go to sleep at night with a smile on my face, 'cause I know who I am and I can't ever be.
I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst. If you stay forever, let me hold your hand. I can feel those places in your heart no one else can. Let me show you love.
Good afternoon, ladies and gentlemen. Welcome back to our 10th University of Malaysia Sarawak Public Health Seminar 2024, themed A Collaborative Call to Action for a Climate Resilient Future. We have finally reached the moment we have all been eagerly waiting for, the announcement of the winners for the best e-poster and oral presentation. For the information of all the participants, we have received a total of 22 e-posters and 11 oral presentations. After the evaluation and judging sessions, we have now come to the announcement of the winners. Without further ado, I will hand over the floor to Dr. Muhammad Faisal bin Abdul Rahman to announce the winners of the oral presentation and e-poster competition.
Thank you, Dr. Lalita. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera to esteemed judges, participants, and beloved attendees. I am delighted today to announce the winner of the 10th UNIMAS Public Health Seminar for both e-poster and oral presentation categories. This year, we witnessed an exceptional display of research, innovation, and dedication from all participants, making the judging process both challenging and inspiring. Before revealing the winners, it's essential to highlight the criteria upon which the submission were evaluated. So for the oral presentation criteria, the first criteria is on the content organization. It's basically about the clarity and coherence in structuring the presentation. Number 2 is on the analysis and the discussion, which related on the depth and insightfulness of the analysis and discussion. And number 3 is on the conclusion, which is about the effectiveness in summarizing the key findings and implications. And number 4 is about the use of visual aids. It's about the appropriateness and effectiveness of visual aid in enhancing understanding. Number 5 is about the delivery. It's about the quality of presentation delivery, including the pace, tone, and engagement. And finally, number 6 is about the ability to answer the questions, which is about the competency in addressing queries and engaging in discussion. After meticulous deliberation, the judges have determined the following winners. The third place goes to Dr. Lalita Mala, anak perempuan Manyong from PKD Larut Matang and Selama Perak with the title Determinants of Older People Quality of Life or PQOL in Rural Sarawak, Malaysia. Next, the second place goes to Dr. Muhammad Burhanuddin Helmi bin Zanail from UM with the title Childhood Malnutrition Among the Orang Asli Children in Peninsular Malaysia. Finally, for the first place in the 10th UNIMAS Public Seminar for free paper oral presentation competition, the prize goes to Dr. Hazlino Mamahata from USM with the title Spatial Interaction Between Endemic Tropical Acute Bacterial Febrile Illnesses in Northeastern Peninsular Malaysia. Congratulations to all the winners. Now, let us go to the e-poster competition. Before I announce the winner, again, let us understand the criteria upon which the submission were evaluated. For the e-poster criteria, the first criteria is on the content organization. Basically, it's about the clear and logical arrangement of the content. And number 2 is on the visual presentation. It's about the effectiveness of graphical element in conveying the information. And number 3, documentation of sources, which is about the adequacy and accuracy of source citations. Number 4 is on the quality of sources. It's about the relevance and credibility of the sources used. Number 5, on the spelling and grammar, which is related to accuracy and proficiency in writing expression. Number 6 is on the public health importance, which is about the significance of the topic in addressing public health challenges. Number 7 is about the innovativeness, which is related to originality and creativity in approach and solutions presented. After meticulous deliberation, the judges have determined the following winners. For the third place, the prize goes to Dr. Mardiah binti Azmi from PKD Bachok, Kelantan with the title The Epidemiological Characteristic and Incidence of Dengue Cases in Bachok, Kelantan, 2019 to 2023. Next, the second place goes to Dr. Saban Singh from IMR with the title Optimizing COVID-19 Control Measure in Malaysia, Leveraging Disease Transmission Intensity and Health Response Capacities. Finally, the first place in the 10th UNIMAS Public Health Seminar for e-poster competition, the prize goes to Dr. Muhammad Rujhan Hatfi bin Muhammad Daud from USM with the title Spatial Analysis of Measles Infection in Malaysia 2018 to 2022. Congratulations to all the winners for their outstanding achievement. Your contribution has significantly enriched our seminar, and we commend your dedication to advancing public health research and practice. Thank you to all participants, judges, and attendees for making this event a success. We look forward in witnessing further impactful contribution from all of you in the future. Now, I would like to give back the stage to the MC.
Thank you very much, Dr. Muhammad Faisal bin Abdul Rahman, and congratulations to all the top 3 winners. We would also like to thank participants who have submitted the abstracts and participated in oral presentations. Our appreciation also goes to all the abstract evaluators and judges. Now, to claim your well-deserved prizes, we kindly advise you to reach out to our secretariat as soon as possible. Once again, let's give a huge round of applause to our winners. Ladies and gentlemen, throughout the past 2 days, together we have delved into critical discussions on the climate change and its implications for the public health, the environment, and psychosocial well-being. The speakers have also highlighted the crucial interplay between environmental justice and health equity, emphasizing how these factors can either drive proactive health intervention or exacerbate the negative impact of climate change. We hope that all the participants have gained the knowledge and skills necessary to comprehend and advocate for effective mitigation and adaptation strategies as a part of a collaborative call to action for a climate change future. As we draw near the conclusion of this remarkable event, it is my honor to invite our esteemed chairman, Dr. Muhammad Faisal bin Abdul Rahman, to share a few words of appreciation. Thank you.
Thank you, Dr. Lalita. Yang Berusaha, Associate Professor Dr. Jeffries Anak Stephen, the Head of Community Medicine and Public Health Department, Faculty of Medicine and Health Sciences, UNIMAS. Yang Berusaha, Professor Dr. Razita Sham binti Safi, the Advisor for the 10th UNIMAS Public Health Seminar. Yang Berusaha, Associate Professor Dr. Sam Frost Anak G, the Course Coordinator for Public Health Seminar. Esteemed speakers, moderators, beloved participants, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. Salam Sarawak Ibu Pertiwiku and salam Malaysia Madani. On behalf of the organizing committee, I would like to extend our heartfelt gratitude to each and every one of you for spending your time with us in this 2 days event. Your passion, engagement, and valuable contribution have truly made this event a success. For your information, this event had reached a total of 435 participants from various backgrounds, including doctors, dentists, pharmacists, science officers, nurses, environmental health officers, and other allied health officers. Not forgetting the lecturers and students, including MPH and the RPH, as well as PhD students from various universities and backgrounds, including from the Faculty of Forestry and Environment UPM and the Faculty of Resource Science and Technology UNIMAS. Now, I would like to bring your attention to the agenda of this seminar. Throughout the event, we have witnessed inspiring discussion, insightful perspective, and meaningful interactions that have enriched the experience of all involved. Your willingness to share your knowledge, experiences, and ideas has created a vibrant and collaborative atmosphere that we are incredibly grateful for. Furthermore, some of the participants also enrolled for our free paper oral presentation and imposter competition. In total, 11 presenters for the oral presentation and 22 participation for the imposters were accepted for the competition. However, in every competition, there are winners who won the prizes. So, congratulations again to the winners. Each of you brought unique skill, talent, and perspective to the competition. Nonetheless, for those who did not achieve the desired outcome, we want you to know that your participation and contribution are still invaluable and much appreciated. Your willingness to share the knowledge and research finding had shed light to the other participants of this event. Thank you once again for your participation and dedication. We look forward to seeing you continue to shine and succeed in your future endeavors. A little bit of the history, I just want to shed light on the background of this event. Our UNIMAS Public Health Seminar is a yearly event which is organized by the third year Doctor of Public Health candidate of UNIMAS as part of the requirement for our professional development to gain experience in organizing an intellectual event before we begin our journey as the public health physician. We have a decade-long history in which we already organized the 10th series of the event. To recall the early days of this UNIMAS Public Health Seminar, we used to conduct this event in the physical form. However, as we navigate through the COVID-19 pandemic, the use of digital advantage is increasing. Therefore, we started to take the opportunity to engage in this digital world to increase the accessibility of the event for more attendees, simultaneously enabling us to amplify the knowledge to a bigger crowd. But who knows the nature of our next event? Let the next organizer decide and surprise us with their version of the event. Regardless, the main objective of the seminar is still the same, to provide the platform for learning, collaboration, networking, and advocacy on the selected subject matters. With that in mind, I would like to emphasize again the theme of our 10th UNIMAS Public Health Seminar. This event was planned by the 12th cohort of UNIMAS Public Health candidate, consisting of 16 students from various backgrounds. We started our journey for this event since September 2023, and Alhamdulillah, today the event has come to the end. Initially, there were several topics that we have shortlisted in the early discussion. However, we noticed that the urgency to address a critical issue that has challenged humanity, not just globally, but also impacted us locally. Therefore, the theme for the seminar was chosen: climate change, a collaborative call for action for a climate resilient future. The topic is so close to us today that we will always think and experience climate change event in our daily life. Throughout this seminar, we have invited experts in the respective field to share their knowledge and experience in handling the issue. To recall, yesterday we touched on the topic of climate change trend and health impact by Dr. Rohaida binti Ismail from the Climate Change Unit IMR. On top of that, we have a symposium on extreme weather and climate change, in which we present two experts of the field. First, we have Dr. Ferolin Tangang from the Academy of Sciences Malaysia on the understanding the link between extreme weather, climate change, and health risks, key findings from the IPCC report. Followed by our Commander Muhammad Khairul Jamil from NATMA, who shares his experience of search and rescue operation during Batanggali landslide in December 2022. Subsequently, we have an insightful panel discussion on the topic of the symposium. Next, we also have Professor Dr. Hidayatul Fatih Othman from the Center for Toxicology and Health Risk Studies, UKM, who talk about climate change and vector-borne diseases. Today, we have another three esteemed experts. Lieutenant Colonel Dr. Ajanta Segamuti from NATMA, who talk about building resilient healthcare and management of disaster. Next, we also have our beloved Professor Dr. Andrew Q on the environmental justice and health equity, disproportionate effect of climate change on marginalized communities. Finally, we also have our own Professor T.S. Dr. Shanti Farida binti Saleh from the Institute of Sustainable Development and Renewable Energy, ISUR UNIMAS. She talked about climate change adaptation and mitigation in public health, sustainability, carbon city, and impact on environment. Overall, what a wonderful topic has been discussed in these past 2 days. Without those esteemed speakers, the event would not be complete. A special thank you again to our speakers for their exceptional contribution. Their expertise and enthusiasm has been instrumental in making this event a resounding success. As a result, we can understand that a call for action is not just a rhetorical statement for the public health perspective only, but it's a call for executable action from various disciplines. Hopefully by now, you realize that we are not alone and should not work in silo. Perhaps this platform can raise your awareness, foster interdisciplinary collaboration, and advocate for meaningful action. Subsequently, we can make a difference in the fight against climate change. Together, let's work toward a future in any capacity that we can to make our planet healthier, more resilient, and sustainable for generations to come. Before I end my speech, I would also like to express my appreciation to all of my colleagues in the third year of the UNIMAS DRPH program who tirelessly put an extra effort to make the event a success. Not forgetting the lecturers, our fellow colleagues in MPH and the RPH program, and the staff who always supported us from the preparation stage until the end of the event. Definitely, this UNIMAS Public Health Seminar will have a sequel by the next generation, the 13th cohort of UNIMAS DRPH candidate in 2 years' time, 2026. We wish you all the best for the next seminar. Therefore, I encourage everyone here to stay tuned with us and keep updating for the next event. I cannot guarantee you the nature of the next event, the exact time, or even the venue yet, but I can assure everyone that the upcoming event will be spectacular, wonderful, and worth your wait. Finally, thank you once again for your participation. We hope that we reach our objective for the event, and we are truly sorry for any inconvenience that we caused throughout the event. Until we cross paths again, take care and continue your unwavering commitment in fostering a healthier planet. Thank you.
Thank you, Dr. Muhammad Faisal bin Abdul Rahman. Now we have come to the end of 10th University of Malaysia Sarawak Public Health Seminar 2024, themed A Collaborative Call to Action for a Climate Resilient Future. Now, I invite the head of the Department of the Community Medicine and Public Health, Faculty of Medicine and Health Sciences, UNIMAS, Associate Professor Dr. Jeffrey Anna Stephen, to deliver his closing speech.
Good afternoon, everyone. To Yang Berusaha Professor Dr. Rashida Sham binti Shafi'i, Advisor for the 10th UNIMAS Public Health Seminar. To Yang Berusaha Associate Professor Dr. Sam Frost Anaji, Course Coordinator for the Public Health Seminar. Yang Berusaha Dr. Muhammad Faisal bin Abdul Rahman, Chairperson of the 10th Public Health Seminar. To all esteemed speakers, moderators, beloved participants, and ladies and gentlemen. As we draw to a close, I want to express my heartfelt gratitude to each and every one of you on your journey with us since yesterday for this crucial discussion on the intersection of climate change and health. Throughout our time together, we have explored the profound impacts of climate change on human health, from the direct effects of extreme weather events and air pollution to the indirect consequences, such as food insecurity, vector-borne diseases, and mental health challenges. We have heard from experts who have illuminated the complex web of connections between environmental degradation and public health outcomes, underscoring the urgent need for action. But amidst the challenges, we have also uncovered opportunities for resilience and adaptation. We have seen how communities are coming together to to implement innovative solutions, from green infrastructure projects that mitigate the effects of urban heat islands to public health interventions that address the health impacts of climate-related disaster. By working collaboratively and harnessing the power of science, policy, and community engagement, we can build healthier, more resilient societies that are better equipped to confront the challenges of changing climate. As we reflect on the insights shared today, I urge each of you to carry forward this knowledge and inspiration into your own spheres of influence. Whether you are a health professional advocating for climate resilient healthcare systems, a policymaker working to implement evidence-based strategies, or an individual committed to reducing your carbon footprint and promoting sustainable practices, there is a role for each of us to play in protecting public health in the face of climate change. I want to extend my deepest gratitude to our esteemed speakers and moderators for their expertise, passion, and dedication in addressing these critical issues. Your contributions have been invaluable, and we are grateful for the knowledge and insights that you have shared with us today. And for the winner for the e-poster and oral presentations, kudos and congratulations. May you have fly higher in your future endeavor and cherish in the world of public health. For the participants in the oral presentation and e-poster that did not win the prizes, please do not give up. You actually had won the first step that sharing your study results to the community. Winning is just part and parcel for the competition, but the most important thing is the dissemination of information from the study conducted. Please continue to share and help educate our community. I also want to thank all of you participants for your engagement, thoughtful questions, and commitment to learning. Your presence has enriched our discussion and underscored the importance of collaborative action in addressing the complex challenges posed by the climate change and health. Not forgetting those participants who participate in the e-poster and oral presentation competition, which made the entire event more meaningful. At the same time, congratulations to all the winners. As we conclude this webinar, let us remember that the health impacts of climate change are profound, but they are not inevitable. By working together with empathy, determination, and a shared commitment to equity and justice, we can create healthier, more resilient communities for generations to come. Thank you once again for your participation. Let us continue this important conversation, advocate for change, and strive to a better, healthier, more sustainable future for all. Until we meet again, take care, stay informed, and keep advocating for a healthier planet. Thank you.
Thank you very much, Associate Professor Dr. Jeffrey Anak Stephen. Ladies and gentlemen, with that, we come to the end of the 10th UNIMAS Public Health Seminar 2024. I hope you have found this seminar to be informative and useful. Last but not least, we humbly request all the participants to fill in the evaluation form to evaluate our 10th Public Health Seminar. The link and QR code has already been shared with all the participants. For your information, this link will remain active until 4:30 p.m. Should you have any inquiry, please feel free to contact us at the chat box. E-certificate of this seminar will be sent to all the participants via email. Before ending the seminar, we are thrilled to present to you the showcase of submitted e-posters and free paper abstracts. Thank you all for joining us for this past 2 days. On behalf of the organizing committee, I would like to apologize for any shortcomings during this seminar and hope to see you all again at the 11th Public Health Seminar. Thank you very much and have a nice day.